is the is that speaker in the way? Yeah. One second. Let me see what
All right, are we ready? Okay, is everybody ready? Okay, good. Good morning. Good morning, folks. Thank you. We're gonna try that again. Good morning. Okay, yeah, okay. You had your Wheaties and your coffee this morning. Thank you. And good afternoon. Go ahead. Good afternoon to those who are watching online from the East Coast as well. Good morning to those who are watching online from the Pacific Coast. My name is Ajwa Chimating. That is Ajwa Chimating from the National Minority Quality Forum, and this is For Your Health News live at the Exchange at Essence Festival. And I have here with me the esteemed, honorable, and a personal favorite of not just myself, but the National Minority Quality Forum, Congressman Troy Carter, your congressman here in good old New Orleans. So, Congressman, you want to say hi first?
Hello, everybody. First of all, thank you for being in my fair city, New Orleans, where we've got food and music and great people. Thank you so much for the great work that you do. I'm honored to be here with you. I'm one of your fans. So happy to be here and happy to spend some time with all of you, maybe answer a question or two when we finish. But God bless you. While you're here, have a great time, eat some good food, love each other, take care of each other, and take some of that back home, because that's what our community needs more than anything else right now.
Thank you so much for that. Now, Congressman Carter is a leader in Capitol Hill with the Congressional Black Caucus. But today, we're going to focus primarily on healthcare, obviously, because we're NQF. But I know there are a few other top questions in mind as well that we will get to during the Q&A. But we need to start with, obviously, what happened yesterday with what they call the One Big Beautiful Bill, which is the reconciliation bill that President Trump signed into law as of yesterday, that includes a number of tax reforms, new tax policies. It repeals a lot of the Inflation Reduction Act, the IRA, and a lot of helpful provisions that were in it. But I think what has been really top of mind for folks, particularly those here in New Orleans, is the Medicaid cuts, right? Cuts to Medicaid that are set to go into effect in 2027. So, Congressman, can you first give your reaction to the bill that was the bill that was passed into law, and particularly in regards to the Medicaid cuts?
Sure. Well, I will tell you that this, what they refer to as this big, beautiful bill, is in fact a big, ugly bill. A bill that will wreak havoc on our community and all communities, quite frankly. When you look at the tenets of this bill, even though you mentioned there were some good things to come out of it, let me paint you a picture of the difference in those good things. Tax breaks that are being given, tax cuts that are being given for the richest of the rich in our country are permanent, ever for life. Those breaks that were given to, for example, people that are tipped employees and they don't pay tax on tips, that's temporary. That's only for 3.5 years. It also only goes up to $24,000. So if you make 25, 26, 30, 35, 40, you don't get that break. Tax breaks for the richest rich of America goes forever. Tax breaks that go to our workers who are going to enjoy a small break on their taxes only is for 4 years. There's a lot of gimmick going on here. The reality is some 17 million people will lose their health care coverage. The reality is that rural hospitals will close. The reality is people will die. That's just a fact. And you mentioned the Inflation Reduction Act. I was proud to work on the Inflation Reduction Act and pass it into law under the leadership of then President Joe Biden and Vice President Kamala Harris. Let me tell you what they're doing also in this bill. In the Inflation Reduction Act, we had some of the largest amounts of money that were appropriated to push back against environmental injustice, making sure that polluters and violators were brought to justice so people can, in my home state, Louisiana, in the river parishes, can breathe clean air, drink clean water, have the ability to live like everyone else. They're stripping all of that out. They're taking all of those tenets out that would give us the opportunity to have people live in a community where they are forced to live next door to chemical plants. under our leadership, we fought to make sure that we leveled that playing field. We're talking about in Louisiana, short of Mexico, Louisiana is the largest user of Medicaid, larger than any other state. That says something, particularly when the Speaker of the United States Congress is from Louisiana. The majority leader of the United States Congress is from Louisiana. Yet only 2 of us in Louisiana voted against this big, ugly bill, and the rest of them all voted for it. This is a miscarriage of justice, a travesty. But let me tell you, it's not over. We're not going to quit. We're not going to roll over. We're not tucking our tails and running away. We're going through this line by line and already attaching how we can affect this in the appropriations process to make sure we starve it of the resources to survive. Under the leadership of Hakeem Jeffries, our leader of the Congressional Democratic Caucus, you will find that we are organized, ready to fight. We're not running away. As the first vice chair of the Congressional Black Caucus, I'm proud to stand with my chair, Yvette Clarke, and other members of the Congressional Black Caucus to push back, to fight, to make sure that health equity is real and that we're going to demand a revisiting of all of this big, ugly bill.
Well, I definitely want to get back to you mentioning folks living in Louisiana close to those chemical plants. But first, let's talk about fighting back, because there's so many people here with families that are going to be directly impacted by the Medicaid cuts. What could they be doing right now to prepare themselves for the Medicaid cuts? Or should we be focusing on advocacy? Should we be focusing on trying to fight back against the Medicaid cuts? What actually can be done?
So you probably heard me say, because I said everywhere I go, I talk about the 3 C's. I talk about Congress, us using every tool we have in our toolbox to push back against these horrible cuts, these horrible laws that will impact our community, using every resource that we have. Then I talk about the courts. We've had more than 200 lawsuits that have been filed pushing back against these bills that we believe to be illegal or unconstitutional. And then third, your question, the community. The third C is the community. Having the community join us, use your Twitter sphere, use your voices, use the social media, write letters, make phone calls, peacefully show up, have conversations, and remind them that we're not giving them a pass. Elections have consequences. We got to vote. We got to stay active. We got to stay involved. We got to ask the tough questions. We got to demand the right answers. And then we got to stay in their face. And as it relates to getting ready, as the implementation starts to roll out on what these cuts look like, there are going to be tricks that's embedded in the Medicaid cuts. A part of that is you have to reapply every 6 months. They're hoping that because people are busy living, raising their families, taking care of their children, working, taking care of loved ones who may be ill, we have to be smarter than them. And as the first vice chair of the Congressional Black Caucus, we're going to be working with you and others who have strong platforms that people will listen to help us get the message out, to remind people you got to reapply. For those people who now have to have a work requirement, remember, the work requirement is 80 hours a month, and it doesn't have to necessarily be a job. You can volunteer. You can volunteer at a food bank. You can volunteer at your church. All of those things will count toward your work requirement. We're going to be working real closely to make that plain, to make it available to people, and to remind them coming up to those 6-month thresholds, reapply. They think they're going to catch us sleeping. We're not going to sleep.
Which means you need to make sure that you connect with the congressman's office until their representative here is here. You want to make sure?
And if you follow us at Rep. Troy Carter, on any and all of our social platforms, we have regular newsletters, constant announcements, ways to contact us and other members of Congress if you're from other parts of the world, to direct you to get to them, to make sure that these resources will hit your mailbox 3 or 4 times a day sometimes, giving you useful information on how to stay ahead of this big, ugly mess.
And I was going to add, for those who are not in New Orleans, National Minority Quality Forum, go to nmqf.org. We will be going to 40 countries, 40 states, I'm sorry. We'll be in 40 states across the country, focusing on Medicaid redetermination. So that is what the congressman is talking about, that you need to keep reapplying. Also, you want to make that phone call to your plan right now to let them know, hey, this is something that you're cognizant of. But we will be on site through our NMQF Connect program, helping people reapply for their Medicaid. Congressman, let's talk about Cancer Alley for a second, because you mentioned so many folks living within a few meters of a chemical plant. I don't know if you all know that 56% of communities of color live within 3 kilometers of a chemical plant or cancer waste, toxic waste, cancer-causing toxic waste. This is a significant issue that we are talking about at NMQF. And, what is your advice? Because we know that the good folks in St. James Parish have been fighting through the courts and have not been helped with Governor Landry repealing some of the EPA environmental justice provisions. What is your thought regarding that?
I was proud to, under the Biden-Harris administration, to have the EPA administrator on the ground in Louisiana more times than the history of EPA. We had Michael Regan, who was the EPA administrator here, meeting with Ryan St. James, with Ms. Levine, with Mr. Robinson, working with concerned citizens for Better St. John. These individuals work tirelessly to fight for what they should be given automatically, and that is the right to have clean air, clean water, to have an environment that is safe for them to raise their families. Under the Trump administration, all of that stuff is being reversed. So we have to continue to fight. Listen, we're resilient people. We had to deal with ugliness before. We're not going to quit. We're going to keep showing up. I'd encourage Ms. Levine and all those other leaders at Rise St. James, Concerned Citizen for Better St. John, the Bucket Brigade, and the Green Army, with my good friend and incredible leader, General Honore, who is a tireless leader in this space, nationally, internationally, and certainly right here locally. That we've got these incredible leaders on the ground, and my message is, don't quit, don't get tired, and I know you won't, because we're going to continue working with you. We're going to push through this. We're going to stay in their face. I serve on the Energy and Commerce Committee and on the subcommittee of the environment, and we are in their face every single day. Last week, we had an individual to come and suggest to us that coal ash was healthy. I asked him, I said, would you live next door to a coal ash plant since you think it's so healthy? He said, no. I said, then why do you think other people should? I said, would you use this soil that you said is equal to even just potting soil? Would you plant your tomatoes in that? He said, no. Then why do you think other people will? It's the hypocrisy of their foolishness. They wouldn't do it, but they expect our people to. Ain't gonna happen.
So we need to be up on our screenings, because we know that we're being exposed in this way and protections are being rolled back. National Minority Quality Fund, we have our Cancer State Shifting Initiative. I cannot wait to work with you, Congressman Carter, in St. James Parish to make sure that screenings are being conducted for cancer. You talked about the misinformation in regards to even regarding the soil, but there's rampant misinformation, period, when it comes to healthcare. And Governor Landry rolled back a lot of funding for public funding for information around vaccines, particularly around COVID-19. What are your thoughts around that regarding the rollback of health promotion funding?
I likewise had the opportunity just last week to have Secretary of Health, Robert F. Kennedy Jr., to come before my committee. And I peppered him. I asked him, how could you sit here and talk about repealing funding for the National Institute of Health that does research for dreaded diseases like HIV, AIDS, and cancer? You know what he said to me? He said, they've been putting money in this program since 1984 and they haven't found a cure yet. So because you haven't found a cure, you're going to quit? So people are supposed to just die? I told him that was ridiculous, and that it was a ridiculous assumption that all of the gains that we've had While we may not have found a cure, we're making it better. People are living longer. We're able to provide other medicines that cure it, and not cure it, but help it. And the notion that they're so hypocritical and uncaring about people that they want to take away funding, rather it's funding for health care screening, for prenatal and postnatal care. We have the highest maternal outcomes in Louisiana, anywhere in the country. And you want to take away Black women maternal outcomes. So we've got to keep staying in their face and keep pushing, because there's so many pieces of the puzzle that you may not see. But we're going to continue through all of our platforms, through our newsletters, through our press conferences, through working with social media influencers, to working and going on TV shows, to keep letting the people know with our various town hall meetings. We have town hall meetings almost every week throughout the state to keep our people educated and involved. But we got to stay angry. We got to stay hungry. We got to stay motivated. See, Mitch McConnell, the former majority leader of the United States Senate, said last week, and I quote, "They'll get over it." We can't get over it. They're banking on us getting over it, but we can't. And I know, sister, you won't. You won't let us. And together, we're going to keep you informed, energized, prepared for the fight, and we're going to lead that fight, and we're going to win it.
So I have one last question before I turn it over to the audience, and that is again regarding the latest variant for COVID-19 that is ravaging so many communities, including those here in New Orleans. What is your thought behind that, especially because a lot of resources are being rolled back? How can our communities become more resilient, in the face of these public health threats?
In the absence of the resources that should be applied for measles or for COVID or any other dreaded disease that's out there, many of which we have conquered. And now we're having a repeal. We see what's happening in measles in our country, and we see this new variant of the coronavirus. What we've got to do is we've got to practice good hygiene. We've got to stay our distances. We've got to frequently wash our hands. We've got to look out for our senior citizens, those people that may have high instances because their immune systems may be low. We have to take an aggressive stand, notwithstanding whatever government rollbacks they may have. We as a people have to take control of our own lives. Look out for each other. Wash your hands. Stay a fair distance back. Don't get in each other's faces. Stay clean with your hands, because most of this disease is from hand to mouth. You shake someone's hand, you wipe your face. You shake someone's hand, you wipe the sweat off. You shake your hand, you eat something, you drink something. Those are all ways that we can proactively cure ourselves and protect ourselves from ever contracting viruses.
All right. Does anyone have a question for Congressman Carter? This is your opportunity.
Thank you. That's a very good.
I just want to repeat the question for the question was, what is the difference between the reconciliation bill and the appropriations bill?
So the reconciliation bill is a maneuver, a procedural move that will allow all the budgeting things to be crammed into one instrument, and it circumvents having a higher threshold to vote for it. So by packing it all together, they can pass it with a lower amount of votes in the Senate versus having to have more votes in the House or Senate. The difference between the reconciliation bill, it sets the framework of the budget. Appropriations has to feed the budget. So we go through the appropriations process, all of these policies that were changed with the budget have to still be funded on the appropriation side. Does that help? Okay, thank you. That's an excellent question.
There are opportunities, right, to try to push to have this bill repealed. Can we talk about that for a second?
We can talk about it, but we couldn't stop it. It's just going to be hard to repeal it when we don't have the votes. And I don't want to give people false hope that we're going to repeal something. People said, "Oh, you guys need to impeach Donald Trump." We impeached him twice, but the Senate didn't sustain it. We don't have the votes anymore in the House to do it. So what we don't want to do is to go and tell people things that aren't true. I'm never gonna lie to you. I'm never gonna tell you stuff that isn't true. I'm too old for that. I'm gonna tell you the truth. The reality is we just don't have the votes. So we don't have the votes to repeal either. So I don't want to give the notion we do have the votes to do unless we win the midterm.
Right.
We win the midterms, and then we win the House and the Senate, then we get ourselves a Democratic president. All of this ish goes away.
And midterms
Ish
is
is
only
okay,
next
right?
year.
I can say ish.
And midterms is only next year. Okay, so I mean, right now is the time to start thinking about that. Any other questions before we wrap? Yes, ma'am.
So, oh, I'm finished.
So what she said was, we need to keep telling people what they did. Well, let me tell you, I'll make it real easy for you. They all voted for it. All but two of them voted for this big ugly bill. Every Republican in the United States Congress that I served with, all but two of them voted for it.
Back, those two who say undecided, they didn't know, that is a vote for the bill.
If you were able to watch our leader, Hakeem Jeffries, who spoke for nearly 9 hours straight, he called out every single one of them. Not only did he call them out, he talked about how many Medicaid recipients lived in their districts, how many people would be hurt by this vote, how many people would be hurt by their cowardice act for those who ran from the vote and said they were going to be against it, but then ultimately voted for it. That's the third C. And I thank you for that question, ma'am, because that's the third C. The third C is community. Please help us tell the story. Consider yourselves deputized to go out, tell the story, call them out, and tell them we won't forget at re-election time.
Do we have time for one more question? I'm looking for the timekeeper. He's not here, so go ahead.
Okay, my question is basically a two-part question. One is, what is going to change to help the Black people in America instead of lip service when the Democrats, if the Democrats get back in service? What's going to change other than lip service for the Black community?
Let me give a little bit of a friendly pushback. It won't be lip service, brother. What we've been doing is real fighting. It ain't lip service at all. We've been doing a heavy lift against all odds. 35 hours on the House floor, 27 hours around the clock in committee, 22 hours in another committee, 9 hours straight speaking against this bill. Cory Booker speaking for 26 hours on the Senate floor, going all over this country, going to town hall meetings, going to communities, working with our nonprofits, working with our civil rights leaders, working with sororities, fraternities, nonprofits, community leaders. We have been working. We're not done. We got a lot of work to do. But I will tell you what will happen when we take over. When we take over the House, the Senate, and the White House, you will see, like we saw with the Inflation Reduction Act, the highest investment in working in our communities and industry. You will see the CHIPS and Science Act that provided in-country jobs for our people. You will see information that's going for the inflation with the bipartisan infrastructure bill that put people back to work, building roads and bridges and communities, bringing them together that have been divided by bridges and roadways, bringing our communities back together. We've had more money invested in HBCUs under the Biden-Harris administration than ever before in the history. That's what you're going to see again. And my brother, that's not lip service.
But the best thing of all that Black people thrived over for centuries is having a trade. They took all the trades out of the high schools. You promote college. College is great. But if you can't nail a board, you can't build a house, what good does a degree do?
We are doing both. And again, under the leadership of Bobby Scott, who's the chair of education, when we were in charge, more money was put into trade schools, more money was put into HBCUs, More money was put into Pell Grants so people could go to jobs where they can learn how to weld, how to become contractors, how to become plumbers. Those are all honorable, well-paying jobs. And for those who don't want to go to college, that's absolutely an option that we will continue to promote. But we will never abandon a 4-year college where people can go, because a part of the okie doke is to start telling our kids, you don't need to go to college. They don't want us educated. They'd rather have us not. So we're going to offer simultaneously, go to a 4-year college, go to a 2-year college, go to trade school, go to technical college. We want you to have a menu of all those options.
I want to thank Congressman Troy Carter so much for this conversation today. I think the takeaway is that y'all got to vote. Isn't that the takeaway? And that there's an early opportunity with the midterms. It's time that we become health voters again, because so much was on the line with this recent bill that impacted our health. You can join National Minority Quality Forum with our advocacy efforts around specific health issues, but you also need to stay informed, right? Did you know about half the things that Congressman Carter just mentioned? So join For Your Health News. For Your Health News, FYH.NEWS. We'll keep you informed as well, and we'll have Congressman Carter back on our platform. We'll be back at 1 p.m. with Dr. Thomason from Vituity, which is a great, excellent company, Black-owned, helping to advance healthcare. So join us at 1 p.m. for that. Thank you so much, Congressman.
If I can close with one point, take care of yourselves. Do your blood pressure screening. Do your prostate screening. Stay ahead of your health. Don't wait until you're sick. Preventive care is a lot easier and a lot cheaper to care than once you're already sick. Get your mammograms. See your doctors regularly, and encourage brothers, because we don't always want to go to the doctor. Tell your husbands, your boyfriends, your uncles, your grandpa, your sons, you gotta go to the doctor, man. Deal with your physical health and your mental health. It's important, and you're not alone.
On that note, Congressman, in fact, we have a doctor right behind us. You can talk to your doc at the NMQF Connect Center, and we're also doing breast exams on site right here today. So please make sure you get those screenings. Thank you so much, Congressman.
Thank you. Keep doing the great work you're doing.
Hi everyone, I'm Ajwa Chimerting from the National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And I'm sitting here with Polly Joseph. Could you introduce yourself?
Sure. I'm Polly Joseph. I am an investigator, and I am originally from Bethesda, Maryland.
Welcome, Polly. We're so pleased to have you as part of the 40 Under 40 class of the National Minority Quality Forum's Minority Health Leaders. Congratulations for everything that you've achieved in your career. And, you know, this is an interesting time for us. You know, I think that generally folks are looking for leadership in a lot of ways, including in healthcare. And we're so excited because this class, we feel, have leaders from all sorts of disciplines. And so I would want to ask you, you know, particularly during this time where there's a lot of either misinformation or folks are wondering about access to care, what would you say to others in your class or other health leaders about, you know, what they could be focusing on in their career and how they could be using their platform at this time?
That's such a wonderful question. One of the things that I would say to either the current class or previous classes like mine, I'm class of 2020, so I happen to be in the middle of the pandemic, is that, you know, just to focus on your passion and focus on building in the curiosity of what drives you. That will never change. No matter how the climate changes, what drives you never really change.
That's
because
true.
it's really within you. And that is what's going to help the community. That's what allows us to really do the day-to-day that we need to do. And then we can also provide the community with the right information that they need.
Right. What would you say has driven you to this moment? Could you share a little bit about your personal story, about why you chose your career and what, you know, drives you on a daily basis?
So I am a trained nurse. I'm a family nurse practitioner, and I also did a PhD in genetics. So I run my own lab, doing a lot of work, primarily focusing on the chemical senses. So I've studied the senses of taste and smell. So it's really an area that most people don't study. But one of the things that really drove me to that area in particular was really working with patients. So working with patients, you know, on the bedside, working at the nursing home, and seeing how patients will sometimes spit their medication, and often will say, oh, they're just not adhering to their medication. But often we really didn't think that the medication really tasted too bitter, right? So those changes are happening with age and how they influence nutrition, but as well as something that we do on a day-to-day basis clinically, like provide medications to other patients that we have. And that's one of the things that motivated me, but also one of the things that really motivates the work that I do as well is the fact that these particular senses are not measured clinically, especially in underrepresented minorities. There's really not a lot of tools out there. So one of my main goals is how can we embed this into primary care settings and have screening tools that can allow us to detect diseases earlier. For example, Alzheimer's, Parkinson's disease that is affecting our communities.
Wow. Okay, so much to delve into. Let's unpack that in 3 ways. One is I would love to learn a little bit more about the screening tools that you're talking about. I don't think a lot of people know what exactly you mean. Could you share exactly what that looks like in a primary care setting?
Yeah, no, that's a fantastic question. So our sense of smell tends to be affected at least 10 years earlier for individuals that have Parkinson's disease, for example. So if we can have screening tools that allows us to say, okay, this individual has a decreased sense of smell, now we have to monitor them over time a little bit more. That can at least tells us a lot earlier that this person is a particular risk. However, right now, we really don't have anything embedded in clinical care.
Wow.
So if you get sick, you probably will be sent either to a neurologist, to an ENT, and it's very few individuals that actually do this test. most of it is relies into clinical research.
You know, Alzheimer's is such a tough disease, particularly in communities of color where maybe we don't understand the signs. Could the screening tools that you're mentioning help with that process and be something that helps this community that often underdiagnoses and misdiagnoses this issue?
Absolutely. And sometimes it's things as simple as noticing how maybe your grandmother's cooking has changed, right? And often they're adding more salt or sugar to the food. And you're like, oh, it's salty.
You know, grandmother wouldn't get that wrong, right?
Right. You know they wouldn't get it wrong. So when you notice those subtle changes, it tells you that something might be wrong. And sometimes what's wrong is like their sense of smell. Because the sense of smell and taste are very much linked.
It sounds so simple, but yet it's complex, isn't it?
Totally.
You mentioned lack of measures, you know, in order that currently exist. What needs to happen to change that?
Policy. There needs to be a lot of policy change in, who reimburses for these tools that we are developing. We need things embedded, as I said, in primary care, but also neurologist offices. So sometimes we are asking for a little bit more to be done, but however, it's things that can help the community in general.
Right. Is this something that the average person can ask about or inquire about? What should the average person do if they're interested in this?
Yeah, one of the things is like if you notice that there's a change, there's advocacy groups that are primarily focused on this area, like the Smell and Taste Association of North America, for example, where you can learn more about what to do, where are the clinics where individuals can go. But if you notice a change, don't just attribute it to like, oh, like this is just extra salt in food, but just if you notice a pattern, to really start asking, even the primary care doctor, sometimes it's just asking that question that pushes an inch of curiosity.
This is so interesting, but I have one last question for you, and that is, you mentioned that not a lot of people know about this practice, in health. And of course, representation is so important to be able to determine things like taste, especially kind of our food, we have a different level of pepper, maybe a different level of seasoning. I'm just so curious about the importance of representation in this field. Is there a ton of representation of communities of color in this field?
Sadly, not. I think as you asked the question, you probably already knew part of the answer. And that's part of like the goal. It's like, how can we increase representation where we're not using only weird population, Western, European, or populations in studies, but we're also considering diverse communities. So one of the things that we were able to do during COVID is we created the Global Consortium for Chemosensory Research. So it's a consortium that includes individuals from 66 different countries. So we were able to do studies across all these countries. And that was a way to really increase representation from individuals in Asia, Middle East, as well as other underrepresented groups. So at least the needle is moving, but we do need more representation, not only in the population that we study, but also on the researchers that are doing the work and the clinicians.
Well, I want to just also say I commend you because you're class of 2020 and you're here today helping to welcome the class of 2025. How important is it for you to sort of continue to be a mentor, and what would you say to others in the future who will be the incoming classes of the 40 under 40?
Not to give up. Sometimes the world can look a little challenging, but just to keep focus, and as I said earlier, just to seek that inner curiosity that leads to questions, and not to give up on that neither. Because the day that we give up not only on ourselves, but we give up on our communities.
Wow. Thank you so much, Polly. It's nice to have you.
Thank you.
We'll see you again, right?
Absolutely.
Okay.
Did you know that in the United States, nearly 2 million people are diagnosed with cancer each year? Tragically, cancer deaths are disproportionately higher in underserved communities due to barriers in early detection and treatment. At the National Minority Quality Forum, our mission is simple but powerful. We believe every person deserves the chance to live a healthy life, no matter their race, ethnicity, income, or where they live. Since our founding, we've been dedicated to reducing health disparities in communities that have been overlooked for far too long. Low income, rural, Black, Hispanic, Asian, and Native American. We lead the Cancer Stage Shifting Initiative and the NMQF Community Health Biobank, advancing diverse patient data for critical research in 20 underserved, high-risk cancer communities. This initiative focuses on addressing health disparities in cancer care by creating a registry and biorepository to support earlier detection and equitable access to innovative treatments. By working with 100,000 participants, we're taking a big step toward addressing cancer disparities and creating tools that work for everyone. Together, we can shift the fight against cancer to earlier stages and give every community a fighting chance. The National Minority Quality Forum is committed to transforming the health of our nation. Learn more about the Cancer Stage Shifting Initiative and how you can support this life-changing work at shiftcancer.org.
You can actually.
Oh, okay, okay. How does that look to y'all? How's that to y'all?
I think it looks fine, except for the fact that it's
The block is there.
they're vertical.
Can it zoom? Oh, no. Can you zoom in on that, Victor, or no? He said he can.
No,
Oh,
he's
no, he
saying the
can't.
camera. Let me see. Oops. Oops.
Go to Arju's iPad for a second.
Okay. We have to get some folks here. I have to get some folks.
Yes, it looks good. Yeah. I mean, it's the best we can do. Wait, hold on, hold on.
Okay. The medical myth buster. We're going to be busting some myths and talking chat. Or can we just put it to the side, just a little bit, like right here?
Oh,
Yeah.
yeah, yeah. But if you keep it right there, that's perfect. All you have to do is just smooth it down, maybe like 5 inches. All this fine. Yep. This is good. We're recording.
Okay, wonderful. I see it. Hi, good afternoon. Okay, you can get louder than that. Good afternoon. Oh, yeah, you're right. Okay, you've got voices. Wonderful. We're going to use them today because at some point we'll turn it over to some questions from you all. But we're going to chat a little bit first, okay? That's all right. So, hello everyone. I'm Audra Martin of the National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And for this segment, we're going to be talking about demystifying clinical trials. We're going to be talking about maybe some misinformation and general myths you've been hearing about healthcare with the one and only medical mythbuster, Dr. Joelle Gravel. Joelle, would you like to introduce yourself?
Yeah, hey everyone, my name is Dr. Joel Burdell. I'm an internal medicine resident. That basically means that if you're in the hospital and you're having to get treated, let's say you're having COPD, which is obstructive pulmonary disease, or an asthma attack, or some of your stomach is hurting, I'll be the doctor that comes in and tries to figure out what's going on, and take your labs, and try to make you healthy to get you in the hospital. For the past few years, I've been using social media as well, so Instagram and TikTok, to talk about disparities in medicine. Why is it that in many different metrics, Black communities unfortunately are disproportionately more likely to, for example, get asthma or to be diagnosed with melanoma at later stages? So I really try to demystify these large topics, break them down in ways that our community can understand. So when we go to the doctor's office, we have a little bit more information, we know more of the right questions to ask, so we feel like we're getting our health really listened to, and that way we have the connections that we need to make sure that our families and ourselves are healthy.
One of the biggest issues right now, as you might know, is that only 5% of people of color, that's basically Black and brown folks mostly, are participating in what is called clinical trials. Now, I will say at the National Minority Quality Forum, we don't love the word trial because of the fact it can scare people, you know? But these clinical trials are very important clinical research programs that are the gateway to innovative medicine. It's the way a lot of people are getting access to medicine that they may not ordinarily do. Joelle, what would you say is the greatest myth that you've heard around clinical trials?
I think a lot of times people realize that medication that we receive, we don't just get it, right? It has to go through a process where it's tested in different ways to make sure that it's actually going to be healthy and not going to harm us or hurt us. I think one of the biggest myths I've heard out there is that medications aren't actually looked at or researched in a way to make sure that they don't harm our bodies. And so I really always try to make sure to talk to people about what the clinical trial, clinical research pipeline looks like. That looks like actually getting a medication. Oftentimes the medications that we're using natural remedies array that people are using, that we found out there was properties that could work for our bodies, and that we start using them. And so it's a trial that undergoes first testing in the basic laboratory setting, testing that on animal models before it even gets to the human trials in the first place. And so it's a long process, and it's a process that is done in a way to make sure that it's totally safe for individuals. I think a lot of other people, also people don't know that clinical trials, you only know about them if you ask about them. Unfortunately, most people don't understand to ask their doctors, is there a clinical trial that's right for me? So let's say that you have breast cancer. The medications you've been getting aren't working, but there might be a new novel medication that could work for you, but because we're not asking the right questions of, could this medication work for me? We don't even realize that we have to go out and figure out what other options are there for me.
Yes, and I also want to remind those who are watching on the live stream, apparently we have 6,000 people watching on our live stream right now. If you have questions, please put your comments in the chat and we'll forward them to Dr. Joelle Burnell. Now, you talk about the fact that it's a long process, that has a lot of steps and a lot of standards to reach, right? What would you say have been the biggest misunderstandings around maybe safety procedures or safeguards that are in place for clinical trials?
Yeah, I think there's multiple different safeguards. There's different phases. Each phase tested in different groups, different individuals. I will say, unfortunately, for a long time, we actually weren't testing it in specific population groups. So it wasn't until the late 1990s that we actually tested on women medications. And that's unfortunate because that means it could have medications could have been working differently for different populations without knowing it. Thankfully, that's been corrected now. And so now when we test different medications, we make sure that it's done on all different populations, all different ethnic groups, people from different areas to understand how is it going to work in different people. Because we're all different, no matter where we're from, even within racial groups. There's actually more diversity within racial groups than there are between them. That matters because the more individuals we're able to get to actually be able to have these conversations, we will be getting these clinical trials that be making this better. That's how we actually have access to it. And oftentimes, these clinical trials are going to other communities that are affluent or wealthy, because they know to ask these questions and know that the medication could work for them, but that process takes a while for it to get on the market for everyone else.
We're going to talk about how folks should be asking questions with your doctor in a second. But you mentioned the past. So let's talk about Tuskegee, if you may, because everybody here knows about the Tuskegee experiment, right? Okay. What do you say is probably the biggest misconceptions about the Tuskegee? What's the biggest misinformation that you might have heard about Tuskegee?
So Tuskegee obviously was one of the most horrific acts in the United States when it came to clinical trials. For those who don't know, what happened was in Macomb, Alabama, they basically had a cure for syphilis. The cure was penicillin, but they didn't give that cure to individuals that were part of the study, even though halfway through we found out about that cure. And so it was an example of withholding medical treatment that could have been good for these populations. What a lot of people don't know, though, is that a lot of the safety centers that we have today came out of that. So one, informed consent. Have you all heard about that? What informed consent is? So let's say you're getting a procedure, or you're taking medication, or you're joining a clinical trial. We have this process of informed consent where we walk you through the risks, the benefits, all the things that can be happening to you. That came out of the Tuskegee trial happening. There's also been increased standards when it comes to patient safety and patient protected patient information. And so those were all things that kind of the unfortunate tragedy that happened. So I think the biggest misunderstanding is that, yes, that occurred, but what we tried to do was figure out why there were gaps there and then try to fix it. That's not to say that they're not still there. I think it means that we have to be aware and ask the right questions. But thankfully, some of the standards that caused and allowed for some of these experiments to happen have been taken away.
Yes, thank you so much for that clarification. So let's talk about the fact that, oftentimes you hear about clinical, I like to say, research programs or clinical advancement programs, because really it's about access to the most groundbreaking medicine you've ever heard of. How should these folks be navigating the conversation with doctors just to ask about information regarding clinical trials?
I think simply one of the first questions you ask is, do you know any clinical trials for my specific condition? Starting it there. And if the doctor says no, it can be a mutual conversation at that point. It can be are that something we're able to look into, or do you have colleagues that may know about these clinical research advancement programs that may be happening? One thing I have to say is in medical school, we don't learn about clinical research very much. We don't learn about how to actually talk to patients about it, or even how to do the research ourselves. That means it has to be a mutual thing between patients and their providers, where we're learning together. I think doctors can help guide you to the right spaces to say, here's a trusted resource, here's one that should not be trusted. But at the end of the day, I always say that we have to be our own advocates because we know what we're going through better than anyone else will ever. We know what it feels like. We know where it hurts. We know what needs to be fixed. And so when we talk to doctors, it needs to be a mutual conversation between the patient and provider. We're really trying to figure out what are the goals we have, research or medicines are out there that can get me to the end. And also understanding that not all things are created equal, that not all diseases are equal. I think even when we think about something like cancer, cancer is a collection of different diseases. So one clinical trial for breast cancer is very different from something for kidney cancer. We can't kind of compare the two. So it's all about really getting information and working on a personalized basis with your physician to be able to find the right resources for you.
You know, you mentioned the fact that sometimes we have symptoms that we ignore. You know, we don't talk about with our doctors. You know, we are here, National Minority Quality Forum, particularly talking about access to lupus clinical trials. So if you haven't already stopped by at the Her Health Hub, please do that because lupus is an autoimmune disease where sometimes we're just really tired. And we think that that's normal because we decided to normalize tiredness in our community. Or, you know, we have hair loss, patches in our hair. We don't understand what that is. Or rashes, unexplainable rashes. Really, with anything that feels abnormal, we need to be having that conversation with our doctors, correct?
Yeah, I think that's why you need a primary care physician. I think a lot of people don't have primary care physicians, or they use the ED or other resources just as needed. There's nothing wrong with having someone you can go to consistently, and maybe once a year getting a checkup, right? Especially when you get older, there could be things that keep going on. So right now, as I mentioned, I'm an internal medicine resident, and when I see patients in primary care clinic, we have a little list of what we call care gaps. That could be that we need to check someone's PSA level for their prostate. That could be that maybe someone needs to get a mammogram, maybe someone needs to get a pap smear. But those are the things that we need to be staying up to date on. So one question that you should be encouraged to ask your doctor is, am I up to date on my care gaps right now? Are there things that I need to be doing, whether it's checking my liver enzyme levels, whether it's checking my glucose, whether it's checking my HbA1c, if I have diabetes? All these are questions that your doctor should be working with you on, but maybe they're missing it because there's even a lot of other patients. And so making sure you understand your condition is really important. And one thing I was going to say to your previous point of where can people go for resources, patient advocacy groups are incredible opportunities. So you just mentioned lupus. Lupus has a lot of groups online where if you go and find a patient advocacy group or a lupus national foundation, you'll actually be able to go online. They'll have clinical trials there. And they'll also have people that have done these clinical trials that you can actually talk to. And you can actually have a conversation. So that way it doesn't feel like it's separate out or that it's a doctor telling you something. It's a patient that has actually gotten the medication or gone through the research, is actually understanding it. And you then get a support system of other individuals who are having similar symptoms to you, maybe symptoms that you were ignoring before, that you were able to get checked. All that to say that yes, make sure you get symptoms checked out, but it should start preventatively, meaning that you need a primary care physician that you check in on, even if things feel normal, just so you can make sure that you're actually healthy all the time. That's how we get the best care.
I'm going to come to you guys for questions soon, so think of your questions right now. But to that point, you know, I must say, if you check out beyondlupus.org, the NMQF Lupus Resource Hub, which we are talking about clinical trial opportunities there as well. And we also have resources about our Beyond Lupus Patient Network. So it's folks like us, you know, who are experiencing lupus right now. You can talk to your peers about it. Well, okay, Joelle, you reach millions of people a day. Okay, millions. If you don't know about him, get to this. What are some of the interesting questions that you can think of that you have found that really been enlightening to you regarding just the level of misinformation that's out there regarding healthcare these days?
That's a good question. I don't know what the most common question I get is, but I think one that I often see that makes me think a lot about just like where's healthcare going is like how do I find a black doctor? You know, and so I think a lot about the fact that in medicine, there's unfortunately less than 6% of all doctors in healthcare that are black. A lot of people are often saying, how can I find someone who looks like me, or from my community, or understands my needs that I can reference and I can go to and actually get care from? There's websites online that people can access. So I think that's one place that individuals can go. The second question I get is usually for the kids. It's like, how do I get my kids also to be a doctor? I'm all about representation. I've always said that you can't be what you can't see. And we need more representation in medicine overall. Like I said at the beginning, 66% of all doctors are black. So I've been trying to do things like I started an animated digital kids TV show called The Doctor Is In. Check it out on YouTube with your kids, where you can watch it with your kids. And it's a coherent show. We talk about really basic science concepts like asthma, and heart disease. And it's really interesting because I've already had parents reach out and say, my kid loves watching this, so what's the next episode coming? Simply because they were able to see themselves represented on a screen where they weren't able to before. So I think really the most common questions I get are about how do I make sure I'm finding the right doctor for me, and then two, if I want my future son, my son or my daughter to become a doctor as well, in the healthcare field, what are the resources I need to go to?
And when is the next episode coming?
That's a good question. Episode 1 is now out. We launched it last week. It's an animated show. We literally live. I think the next one will come out next month, probably. But there's also other modules online that you can do with your kids, from things like making a paper bag model of lungs to making a paper spine on cardboard boxes. So lots of different things that you can do with your kids.
Okay, the doctor is in, and he is in right here. So let's have some questions. Anybody?
First I would like to make a statement and suggest something. Because I know you fight for equity in healthcare. And I was taking an physiology class a couple years ago. And the professor kept saying, black folks were disproportionately affected by heart disease, kidney, and high blood pressure. I mean, you name it, it was just da 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 da. You would never think that the top 10 fastest men and women in the world, black, with these disproportionately negative healthcare outcomes. Also, what and I'm 62 now, so I remember in the 80s when I used to read in the 80s and even the late 70s when I used to read articles about black healthcare. A lot of these positions, first of all, we have a lot of non-black, non-white positions that's been coming into that's becoming doctors in America for the last 30, 40 years as well. And a lot of them don't know that before the 1960s, the largest population of centurions were African Americans. We were 90% of the centurion population. So a lot of people don't understand what occurred after 1950 that changed black healthcare. Because for us to be 12 to 20% of the population in the 1950s, we were 90% of the people who were 90 years old, especially in the South. I think that needs to be not only discussed more, dug into more, and explained what happened in 1950 and 1960s and black healthcare began to change. And I think that also there needs to be incorporated education on the college level of black centurion health. And yeah, I think, when people are being these negative, black negative, especially if people have that best, and the professors might usually don't know that up until 1950, black people were living longer in the United States than any other group in the United States.
So if we can have Dr. Dwyer, and then also I want to answer that question.
Yeah, I think one thing I always try and do in my videos is point out historical context, as you mentioned. I think unfortunately in medicine so often we say exactly what you said, that black people are more likely to get asthma, COPD, but we don't point out the historical reasons why. So you can look at things like redlining, and if you actually look at different populations, you can look at a city and see that maybe in the center, people are able to live 5 years more than average, but you go to a specific area where there's lots of factories, and the healthcare quality of life goes down drastically. They're living less. So I always try to talk about things like redlining that disproportionately put black communities in areas with pollution. And
well, does everybody know what redlining is?
Does everyone know what redlining is? Okay, I'm seeing nods. or the fact like we're in Louisiana right now. Cancer Alley is not too far away. Cancer Alley is an area where literally your chance of getting cancer are 12 times as likely than anywhere else in the United States, simply because there's a lot of pollution that's there from factories. The EPA opened up an investigation, but they closed it. And so these are conversations we need to be having that show that policies matter when it comes to healthcare, that climate change matters when it comes to healthcare, and that specific communities are being disproportionately impacted, not because of race, because of policies that have been created against people with different races in specific communities. If you look at the fact that the zip code system was made because of race, to literally be able to keep different racial groups and understand where they were. So all these things link in directly with health, and the short of what you're talking about is understanding that historical context. And I wish we did that more in medical school. That's why I started my social media channel. I felt like we weren't doing enough of that. I felt like to be a great doctor, you need to understand what we call the social determinants of health. Those other things, other factors beyond your personal biology that can impact your health care.
I want to add to this because this is the core to the work that the National Minority Quality Forum does. Data is so important. We used to have very healthy communities. We were very healthy people. What we're seeing now is the result, as Dr. Joel has mentioned, of decades of basically exposure to poison. 56% of people of color live within 3 kilometers of carcinogenic toxic waste, cancer-causing waste, as well as kinds of other conditions. Interestingly enough, our health system tends to focus on a lot of lifestyle factors or genetic factors when it comes to a lot of diseases. But there's not enough consideration of social determinants of health and the fact that most of people of color, particularly Black folks, live within just 2,500 zip codes. 2,500 zip codes in the entire country. So we're packed in. We're packed into, and we're constantly being poisoned by our air, our water, our soil, all the time. What's happening now, and NQF, we've been tracking this since 1998, is we're starting to see the results. The data that's showing, oh, this is why we are more at risk for, leukemia. This is why we're suddenly at risk for lupus. This is why we're suddenly at risk for almost every cancer type you can think of. And so this is due to, like Dr. Joel has said, historic systematic policies that have put us in place. So that means that we need to be very cognizant of this. And we have to be up on the screenings. And we have to be up on with our doctors because we tend to have all kinds of underlying conditions that we're not even aware of. Even our most active athletes can be failed because they have an underlying condition that we see all the time. NFL players all of a sudden just losing consciousness on the field because they had an underlying condition that they were not aware of, even with access to the top healthcare in the country, because the system isn't designed for us. And so the right questions are not always asked, right? And so that's why we have to ask questions, as Dr. Joel has been saying. We have to be super engaged and super on top of our own health care and what's going on in our community. Dr. Joel, any other things that you would want to point out before we wrap?
Yeah, I think the last thing I'll say is just the 5 tips I give people when they go to the doctor, the things that you can do. So one, I say write your questions down. I think when we get to the doctor's office, we get really nervous. There's something called white coat hypertension that's actually been studied, where if you take someone's blood pressure from a doctor's room in white coat, it'll be elevated because people are nervous when they go to the doctor's office. So write your questions down before you go to the doctor's office. Bring someone with you if you can. That's always a great way to make sure someone else hears the information that you're getting. If you can't bring someone with you, ask your doctor if you can either record your conversation, or maybe you can ask them to call your family member afterwards if you're not in a place to remember it. 3, what I'll say is, this is actually one of my favorites. Ask, what is your differential diagnosis? A differential diagnosis is one of the first things we learn in medical school. It's all the things that could be going wrong with a different individual. Let's say you have shortness of breath. That could be a pulmonary embolism. It could be something like heart failure. That could be cancer, really, like the scary C word. But each of those different things, we'd have to do a different test. Whether that's doing an ultrasound to be able to see if you have an embolism, whether that's doing a CTA or something, or a CT scan. And so it helps you point in different directions, helps you better understand what you need. So I always give those tips to people just when they're going through the doctor to be able to really have conversations. Actually, the last thing I'll say is you can change your doctor. You got to choose someone that you want to communicate with. And that's the first thing I tell every single one of my patients comes to me is I want this to be a relationship. If you don't feel comfortable with me, I want you to tell me so you can find a doctor that will work with you.
Do we have time for one more question? Yep. Okay. Yes. And wait for the mic.
Nice news about the Terrell. I'm pretty short. So, as a student who is a freelance student who is actually working towards to be in your position, you actually sparked the interest in me to share the education of the medical field, in particular neurology, science. That's my niche. I just want to know if I wanted to be in your position where either post videos or the animated show. I love the art and sharing with art. If you can do it all over again, you have to start from scratch. What would be the first steps you would take to start getting to where you are now?
I love that question. And actually, I wouldn't change anything. I think what I would say is, and what I did was be curious about the world and find the gaps where people aren't talking about the things that you think are important. And so I remember when I was in literary years ago, I saw Oprah speak at my sister's commencement, and she said, "Build the resume that you want, not the resume that you think you should have." You know, and what she meant was follow your passion, go for everything, find what interests you. And so when I was in college, I took classes like U.S. history. You know, not knowing that I'd be connecting U.S. history with public health. I did things like speech and debate, not knowing that one day I'd be at the White House meeting with Vice President Harris, talking about reproductive health, and using those same skills that I got from literally high school in medical school and in different spaces. And so don't run away from your passions, even if they don't necessarily feel like they align. Go for whatever you feel like keeps you sparks your interest, and then eventually you'll find a way to merge those things together. So I always had passion for design and animation. And I was like, I want to build a TV show. That's like one of my dreams. And so I found a partner at Ashton Media. It's with my doctor Jose Mori, who's a radiologist. And I was like, this is cool. Another doctor. He's already doing the animation. What can we build together? And so that's finding a coalition of people who have like-minded thoughts like you and starting to build from there together and figuring out what can you do on your own, can't you, and getting other people to fill in those gaps. But I think that the short of it is focus on your craft, you know, and don't shy away from the things that don't feel like they maybe don't make sense right now, because hindsight's always 2020, and eventually we're going to put the pieces together.
I want to just clap for the young man here who's exploring this career. That's wonderful. It's really about taking action, right? That's a big takeaway. Dr. Joel has taken action in his own life. He shared his story. All of us have our story. One thing I'll be remiss to not mention is this concept of, access to life-saving research. And we can all be community scientists, okay? Just want to let you know, NFUF, we have our community health biobank. It's a national clinical research program to investigate the fact that why are we so susceptible to all of these diseases? Why are we experiencing disproportionate rates? And so the only way we can get those answers is we participate. That's a swab of our cheek, a little drop of blood, and then we are building this research together. All of you as community scientists can be like Dr. Joel Rovel here. I want to thank you so much for your time today. I think he might have a few minutes when he leaves here if you have additional questions. So I want to thank you guys so much.
Thanks for being here.
Welcome. My name is Ajwa Chimerting from the National Minority Quality Forum, and welcome to For Your Health News. Your health, your news, your power. And I'm here with Dr. John. Introduce yourself.
Sure. Hi, everyone. My name is Dr. Donnie John. I'm the Executive Director of NovaScript Central, a nonprofit pharmacy based in Falls Church, Virginia, and I'm from Northern Virginia.
And we're so glad to have you here because you are just a long-standing, professional when it comes to the health equity space. You long in the tooth in that regard, as far as being a pharmacist, but also being a health equity advocate. Can you share a little bit about your journey as to how you decided to sort of go beyond your quote unquote 9 to 5 to get more involved in health equity issues?
Sure. I think it's growing up as an immigrant in this country, understanding the struggles that not only my family, but my community. I grew up in New York in a very diverse background with a lot of people from different ethnic groups really trying to figure out how to access healthcare, just services in general. So I think growing up, seeing my parents navigating the system, their challenges, it's really inspired me to figure out how do I fix these issues so that other families don't have to go through the same learning experiences, good and bad, that I've had to incur.
And so in your profession, what was the first thing you wanted to fix?
Health literacy. A lot of times we talk about health, but we don't talk about it in the terms of making people understand. Mm-hmm. And also the cultural competency perspective of not everybody speaks English and not everybody has information in their native language. So for me, my passion over my 20 plus years has been health literacy and cultural competency, is how do we empower communities from all backgrounds to really understand health information so that they can be empowered to make a choice.
And have you seen progress at all? I mean, we've been fighting for health equity at NMQF as over 2 decades. And a lot of people say we're just not really seeing any progress. But have you seen progress in health literacy at least?
Yeah, I think we have made a lot of progress, especially being more inclusive in terms of people with disabilities and having more information that's translatable. There are a lot of great organizations. NMQF has definitely taken the lead in bringing people together for stakeholder conversations around cancer and other really big health topics, and really lending a voice to all communities, regardless of race, gender, or background. NMQF has done a really good job of bringing us together to have a unified message.
So let's talk about hot topics. In your view, your perspective, what are the hottest topics in health equity today?
I still think health literacy is a big issue where we're not breaking down information simple enough to connect people. We have built a lot of great resources, but the messaging is not clear enough where communities feel comfortable, because most people are not going to read scientific journals. They're not going to go to their doctor's office believing what they're hearing. They're really looking at their friend. So we really do need to work on building trust and making sure that communities are getting information the way that they want to hear it, whether it's through social media, whether it's through word of mouth in their community, whether it's through their church, their synagogue. We have to be where people are and really communicate on a personal level. And empathy is the best way to really help us create a strategy around that.
So you kind of jumped to it. You talked about social media, you talked about through church and through our social spaces, but a lot of times folks don't have the information. So how do we close that gap? How do we equip people with the information who are already the trusted voices in order to reach folks?
So I think first we have to build with them. A lot of times we build in a vacuum instead of building with the people that community members are trusting in the room. So finding the trusted messages is not challenging if we look at the right places. A lot of times people use that as a cop-out, as an excuse not to do the work, where English is the primary language. We'll put that on our product roadmap, or we'll figure out how to translate materials later on, instead of designing it from the beginning, where there's lack of resources and a lack of funding. So we have to look at how do we judiciously spend the money to make sure resources are being scalable and actually used by the community that we're trying to target.
Okay, so you talked about resources and spending money. But as you know, federal funding is being cut for a lot of health promotion programs across the country. So where do we find the resources now? How do we fill in that gap?
So I think there's a lot of resources out in the public domain. It's just a matter of knowing how to elevate those resources, because everybody's creating things in different silos. And when we look at the United States, we're a cultural melting pot. It used to be that we would have big metropolitan areas where we'd see predominantly specific ethnic groups. But when we look at Minnesota, it is a very culturally diverse community with a lot of richness in terms of all demographics. And they have a lot of great health education in multiple languages available through their state. Same thing in California and Texas. So we need to look at how do we collate these resources, make it easier to find. And hopefully with AI, it allows us to figure out how do we make it an easy catalog of educational content. My organization, we develop a lot of educational content on our own, really reflecting the diversity of the community. Plus it helps to have a diverse workforce, a diverse staff that can create this content.
So, some people have complained or shown some concern about AI, that it might not account for or protect from racial bias, because AI is still built on human perspective, right? And we have not rid our society of bias. So what do you say to that about the usage of AI in, forming these materials and this messaging, and that concern about bias?
I think that's where the diversity of workforce plays a role. You need to have a diverse workforce that's helping to build these solutions. Because a lot of times, as we've seen in the last 20 years of health technology, people are building it without any of us in the room. So we have to be present and really providing that contribution where it's not that the idea of diversity or multilingual resources is not a product roadmap for 2 to 3 years.
Yeah.
The MVP, the minimal viable product that everybody talks about, should be something that's minimally viable for everybody, not just a luxury to have. But having a diverse workforce will really help solve the problem.
Okay, last question for you. NMQF is just inaugurating its 10th 40 under 40 class of minority health leaders in this country in a particularly tough time. What would you say for those in the newest class about how to either stay the course, use their platform, or, as you said, cultivate the messaging, to advance the messaging, to help people in these communities?
So I think the biggest thing is to still have hope. There's power in the work that we do. And it's just a matter of using this chaos to create opportunity. Mm-hmm. How do we bring people together? Working in the nonprofit space, we have to get creative with having very limited resources. So for me, it's not a new issue of dealing with very limited access to resources and having to serve the greater community. But I think this year's class of 40 under 40 leaders are truly amazing. They have a lot of experience and a lot of brilliant ideas. So I'm very hopeful in seeing how they can kind of push the needle forward, but just staying positive. I think staying positive and figuring out being a solution-oriented framework versus kind of just restating the problem is not enough.
Right.
We need to really work on how do we take what we're doing, scale it, and really think about unifying messages to bring everyone together.
Test 1 2 1 2 1 2 1 2. Oh, all right. All right, test 1 2 1 2 1 2. Test 1 2 1 2.
No, hold on.
Okay, guys, is it a choice? Yeah, you can't be like, my brother. Okay, I don't believe in Jesus. So don't answer questions when somebody gives you the money. Got it? All right, then.
All right. If you're already not at the exchange, please come on over. We're going to have a very lovely conversation here with Dr. Mimi in a minute or two. I'm just looking for a cue. Okay. All right. Are we live on the live stream as well? Wonderful. Okay. Good afternoon, everyone. No, that's not loud enough. Good afternoon. In the back, good afternoon. Okay, you guys look very beautiful today. Thank you so much for being here. I'm Audra Martin from the National Minority Quality Forum, and we're so happy to be here talking about healthcare at the Exchange at Essence Festival. And also hello to everyone following us on the live stream. I heard we have, 5,000 people on the live stream right now, so hello. And if you have any questions, be sure to put it in the comment section. We'll be sure to get it to our guests. Okay, so I'm here with the lovely Dr. Mimi. How many of you excited to see her right now? Wow, you have fans. Okay, so Dr. Mimi, you may know her from Married to Medicine, but she's here because she has a specialty in dealing with psychiatry, talking about mental health, particularly with women. And we're going to be talking about that because this is Essence Festival, right? And this is all about us over here. And so we're going to be talking about how can we manage our mental health, particularly when we're dealing with real crises, real challenges like cancer, especially. Okay? Dr. Mimi, would you like to introduce yourself?
So, hi, Essence. Hello, hello. Yes, I am Dr. Mimi. I am a board certified psychiatrist. I specialize in women's mental health, specifically also reproductive psychiatry. So I follow the woman throughout her entire stage of reproductive health and cycles, whether it's premenstrual, postpartum, pregnancy, perinatal, perimenopausal, but also like for just the core of women's mental health. So all the things that we go through as women. So that can be whether it is professionally, within your career, family, having that particular, sometimes caregiver burden, parenting. So I do all things women, and it just started out as just my own experience. So going through all types of transition, whether it was marriage, miscarriage, parenting of a special needs child, and just having other family members that are going through a lot of chronic medical conditions, and just knowing, hey, there is a mental and emotional piece that sometimes and often, unfortunately, is overlooked. And so just being on this platform, just having that particular voice, reducing that particular mental health stigma and having these type of conversations is my passion, my purpose, and thank you for putting me in alignment.
Wow, you didn't know all that, right? Well, thank you so much for being here. You know, you talk about the everyday challenges, right? What people might not know, so at MQF, we have something called our Support Our Sisters patient network. And that's really particularly for our women that are dealing with metastatic breast cancer because unfortunately it's impacting Black women at rapid rates, really aggressive forms that just take us. You all just heard of Amanda Lewis, right? Just lost her unnecessarily most of the time. And, you know, we just did a survey with our patient network, and when we're talking about women with cancer, even, you know, amongst the chronic conditions that they're dealing with, 42% that they're battling depression. And many of them were battling depression before they had the cancer, right? So now it's like, why is that the case? You know, can you share a little bit about what that might be about? Why we're seeing such rising rates of depression among Black women?
So depression looks different in everyone. And so when you are going to your primary care doctor, you're going to like your general practitioner, OBGYN, sometimes they are doing those particular screenings. And so that screening is called usually a patient health questionnaire. And usually sometimes it's just 2 questions. And sometimes it's just checking a box for that appointment or that encounter. And so if we know that depression looks different, and if we specifically know depression can look different in Black women, how are we asking those questions? How are those 2 questions, those 4 questionnaires, how are they really actually picking up those particular screenings? And so when you are going to your primary care doctor, when you're going to your OBGYN, then these conversations and knowing how to advocate for yourself is pivotal. And so when I say depression looks different, sometimes depression looks like exhaustion. Sometimes depression looks like numbness. Sometimes depression can look like irritability. It can look like insomnia. And so when you're having these conversations with your providers, advocating and just say, hey, I may feel off, and this is what I'm experiencing. Yes, I answered those questions that you did in triage, but also I'm not sleeping, my appetite's not right, I'm not able to focus, my concentration is different. Okay, then also make sure they have someone to refer you to. It may not be, oh, I have this particular clinical diagnosis. Just get me to someone or a place where I can further elaborate, I can further have those conversations. And so I guess your question was, why do we see this rising of depression? Yes, we're doing a little bit better in screening. We are, but we have to do a little bit more, and we have to catch it sooner. Okay, so we have all these preventative medical initiatives. And so with my practice, we want to focus more so on preventative mental health practices. What are we doing? So I tell my patients, what are we doing our core 4? And they're like, okay, what is that? So that is your core 4. And it's just going back to your basics, your sleep, your appetite, your lifestyle. Are you moving? And then also importantly, your social connectivity. So you're having those sisters, you're having those family members, you're having those loved ones. Check on me. Okay, if you see that I'm forgetting something, if you see that I used to live this, have this interest in whether it's rollerblading or doing something and not doing it anymore, check on me.
Well, let's talk about the elephant in the room then. You know, some of us are nervous about having those kind of conversations, right? With the doctor about, I feel a little off. I don't know if it's multimedia, whatever, but there's a lot of stigma around depression. and about seeking help. What would you say to people about that regarding what they can expect when they open themselves up to care?
And that's a real question because in our society, we need to do a better job in mental health screening and we need to do a better job in mental health resources. And so that was one of my passions of going into this particular field. A quick story, when I was in medical school, and you go through different types of clerkships to figure out what you want to do. I went to a clerkship where I was inside the mental health facility, inside the hospital. And during that time, I did see a lot of us. I saw a lot of persons of color in crises. And then when I did to my next rotation, it was outside, it was like a mental health outpatient facility. I didn't see a lot of us. And so why is it that we had to be in crises in order to really get that particular type of help? And so one of my life's passion and works is I want to be that particular outpatient physician or psychiatrist, practice, resource where we're catching it before it gets to that crisis moment. And kind of forgot your question, but moving forward, it was like, okay, so what those conversations look like? How, like, what does it look like when I got the courage to advocate for myself? And I feel kind of okay. What I'm a little bit nervous. Yeah. So my thought is that is the hardest part. That right there is the hardest part, is saying, you know what, I may need to explore this particular emotional or mental health issue condition. And once you do that, and once you really dive deep into getting resources, because finding a mental health specialist is like dating. You got to find someone that you relate to. And so we have been blessed because now we have virtual platforms. Now we can really kind of date that particular therapist, that psychiatrist. So you have choices. You really have choices. And so figure out what that looks like for you, who you connect with, and knowing that is the hardest part. Because once you get there and you get to that person, and for me and my clients, we set forth a treatment plan. We got care plans. I'm gonna refer you to a good therapist, and now we're gonna go to Pilates. We're gonna do yoga. We're gonna go to a sleep person. And so we're really gonna dive deep into how can you live the best quality of life. And what does that mean for you? How have you defined that? And how can I support you and advocate for you?
So you touched on a couple things that I want to get to. One is, and please be aware, you guys are going to ask questions too. So think of your questions now. All right. You talk about that mental health support is like dating. You have to manage your therapy. You have to manage your therapist, right? Yes. Can you talk about what strategies someone can employ to manage and navigate talk therapy, especially?
So I'm a big advocate. When you're coming for your session, guide me. Because I want to know you. I want to know what your passions are, what your purpose, what are your particular goals in treatment. And so I do ask my clients in between their encounters or their appointments, can you please journal? And I don't want you to be so rigid in your journaling. Okay, I gotta do 1, 2, 3, 4. No, just let your mind go. And so during those particular sessions with me, then pull it out if you're comfortable. Let's pull it out. Let's explore it. So now I know what direction we need to go to, because you know yourself better than anybody else. Better than your therapist. I'm just there to help guide and facilitate your journey. And so I do ask my clients, hey, bring your journal. Also, at our practice, we have an app. And so, yeah, we're exploring this technology. So we have an app. And so they're able to chat with us throughout their, in between their appointments, but also they give themselves goals. And so now I'm able to now be your accountability partner. So if your goal was, hey, I want to make sure I'm doing some self-care. And this self-care for me looks like just doing some mindful eating, where I sat down and yes, everybody else, they got their own food. I did not plate it. I told them to do their own thing. And I sat down and I actually ate my meal. Okay? And so those simple things are just pivotal when you're just talking about self-care. What does that look like? How I am really pouring into myself, because we pour out daily. And we're pouring. And now, okay, who's going to pour into us? And sometimes we don't have that luxury. Sometimes we don't have those people that can truly pour into us, and so we have to do it ourselves. And when you're in active treatment with your therapist, with your psychiatrist, then we can help you hold yourself accountable to take care of yourself. So are you exercising? Did you eat today? How did you eat today? Were you at your computer eating? Or did you actually go to the break room, or you left your home office and went to your kitchen? Okay, so little things like that go a long way in your mental and your emotional well-being.
Listen, okay, I hope you guys, I don't see any like pens or paper. Don't be taking notes. But she talked about sleep, normalizing sleep, because we tell ourselves we don't need sleep. No. She talked about mindful eating. Okay. It's so interesting. We're talking about mental health, but you're talking a lot about physical health, things that we need to be doing as well. Right? Let's talk about the strong Black woman. Okay, because you talk about pouring into ourselves, and you talked about how depression can appear differently, especially with us. Some of the strongest women I know sometimes may be exhibiting different behavior, aggressive behavior. Oh, she's just aggy. She's just aggy right now. I don't know why. How often have you seen that with your patients where that could be an exhibition of something that's going on with themselves? And how often do you see this trope of the strong Black woman being the way or being a barrier to care?
I see it myself. So I mean, it's that real. And majority of my patient population is, I guess, that stereotypical strong Black woman. And they're coming and just saying, hey, I don't have that joy anymore. I have poured out, and I know that I'm pouring out, but I don't even know what to do for myself right now. And so we have to now redefine what strong is. And so now I'm telling her in session, yes, you're strong, but also vulnerability is strong. Okay, rest is strong. Rest is resistance. And so, yes, we know that we have had this particular type of, I would say sometimes burden of having to hold it up and be that particular pillar, whether it's in the household, at your job, at the PTA meetings. But sometimes we have to kind of just let go and just say, you know what? They will figure it out. Because right now, I have to be that strong person for myself. And that strength looks like vulnerability. That strength looks like rest. That strength just looks like, how can I just really lean into, we hear softness all the time. But really, what does that mean? How can I really lean into my softness? That means being gentle with myself. Okay, I'm not looking for anybody else to do it for me. So what is that softness, that vulnerability, that rest? That's truly our strength in this moment.
Okay, let's talk about balance, right?
I don't believe in balance.
Okay. All right, explain that.
I believe in integration.
Okay.
And so we want things to be balanced, but we all go through different seasons. Okay. And so, yes, I want that. Okay, here's my kids, there's my husband, there's the job, there's practice. We can't balance all of that. And so, what I do an exercise with my clients and say, write down maybe like 6 to 9 of your values in this season, right? And so that value can be, yes, whether it's parenting, that can be entrepreneurship, that can be your marriage, that can be just values. And so let's just say you have 6 of them. And then I say, well, cross out 3. And they're like, what? I did it. I crossed out marriage. My husband was like, what? I'm like, no, we did our work in that previous season. And so right now, I'm focused on parenting my son who has special needs. I'm focusing also on my self-care because last season I'm grinding, I'm hustling. So I need to really figure out what are your particular values in this season. Doesn't mean that we devalue or we're not saying those other ones weren't important. But right now, my priority in order to kind of continue to move forward are these particular top 3.
So, okay, so let's talk about then strategies, right? Strategies, particularly when you're battling illness, right? And you are having to deal with the everyday, as you mentioned. You know, children, your husband, you know, just keeping the job that needs to pay for the treatment to keep you alive. But then you need to also be aware of your mental health to stay alive. What would you say are some strategies that you would impart upon folks who are dealing with chronic illness from cancer and ongoing?
So first of all, I do want to say we do know that depression, I would say anxiety as well as pain go through the same neuropathic pathway. Okay? So if one is going up, the other one is going up as well. And so we do know that we have to control your pain in order to make sure that the depression doesn't exacerbate, that anxiety doesn't exacerbate. Okay? And so some of the strategy is knowing that, hey, yes, I may have to go through, or I'm going through this chronic medical condition, but I have to make sure I know that everything is connected. And so when I do know that I have all these other responsibilities that can exacerbate my anxiety, that can exacerbate my depression, my pain is going to go up as well. And so when we're talking about integration, making sure that I'm integrating certain things within my particular workday or my daily life that is touching on those particular things. So whether it is your mindful eating, whether it is your chair yoga, whether it is something that you can do within your particular day to address those, whether it's those pain points, those things that can provoke anxiety, your sleep. Make sure we're doing all of those things. So that is one strategy. So knowing that it's all connected. The second strategy is to make sure that you are communicating with your providers and letting them know, hey, this is what I'm experiencing. Because unfortunately, as Black women, sometimes our pain can be seen as less valuable. So making sure that, hey, if it takes that you may have to take someone to that particular office visit with you to advocate, because right now my voice may be not as loud as I want it to be. Okay, so take somebody with you. Make sure you have an advocate, and then also that advocate, make sure they are advocating. Hey, I need access. I need access. She needs access. She needs referrals. She needs resources. She needs all the things. Okay, because right now I may not be able to say it because I'm going through this. So making sure that you know that's all connected, having your advocate, making sure that you're knowing that you're getting access to the things that, hey, you perhaps maybe you overlooked that resource for me, but you need to check it again. Check it again and hey, yes, send me over there and I need that. So making sure that you have access, advocacy, and making sure that you know it's all connected.
I saw a few hands go up earlier. It's a great time, I think, to pause for questions. All right, yes, the mic is coming.
Okay, so I'm an educator and also a nurse practitioner, and so this question is more geared towards I'm a millennial, so the next generation. Okay? So how do you approach clients' level of social connectivity if they've grown up to feel connected mainly through social media, where real life in-person connection or undocumented live events tend to feel unnatural to them?
So two things are coming to mind. The first is right now, this may seem very foreign, but right now I'm on a digital detox. Okay, so I'm off of all social media. Now, of course you don't have business and stuff, but I realize that sometimes when I'm on social media or other digital platforms, my anxiety gets a little high. Okay, and sometimes I don't need to be exposed to all that information all at once because I got a lot of other things that's going on trying to get at me. And so the first part of that is that, hey, see if that may be something that a client or a patient may need to go on. So a digital detox. It doesn't have to be okay completely off of it, but hey, can you really look and see what are your emotions that are connected to this experience? So if hey, I do get some joy from it, and I'm getting inspiration, great. Okay, we can deal with those positive emotions. But if you also see, hey, the length of time that I'm getting on, I'm on this is provoking some negative emotions, whether it is anxiety, disappointment, insecurity, inadequacy, then hey, it may be some time that we need to kind of like the kids, we need to have reduce our screen time. And then that can go from any particular media platform. And then you said the undocumented. Mhm, mhm. That it didn't happen. Yes. Yes.
And just so because the mic isn't there, what she's saying is that you're talking about addiction to social media, to recording yourself, recording what's around you, and it becoming abnormal not to do that, right? So how do you engage folks who may not be able to do a detox because they become so accustomed to that, right?
So we talked about a digital detox, but also if I'm hearing you correctly, hey, if I didn't record it, it didn't happen. And I think this just educating that this is kind of what you're going through, and also educating them on mindfulness. And mindfulness is really practicing being in the present moment, right? And so if you think about it, truly, we only are living in that present moment. We have not entered the future, we've already passed the past. Sometimes in the future, anxiety lives there, and sometimes depression lives in the past. So really just practicing mindfulness, being in that present moment. And that can go through whether it's mindful eating, whether that can be mindful breathing. It could be a kind of mindful exercising or doing some type of progressive muscle relaxation. So really introducing those particular tools to your clients and to your students, and also telling them, hey, it did happen. We don't have to record it. And so this is what you're experiencing. And so I challenge you, teenager, or I challenge you, student, really, hey, practice this mindful exercise. And what did you experience doing that? And then compare that particular experience from, hey, you actually having to record it and not really, really engaging in that moment versus, hey, I put that recording down or put that phone down and I really engaged in this conversation. I really had this particular eye contact. I really know I'm sitting in this chair. I'm with you. I'm engaged with you. And that's teaching some another form of communication. Teaching them also nonverbals, really knowing that it's going to go a long way because how are you going to do in interviews? How are you going to do in relationships? And so really educating them of what they're experiencing and challenging them to say, okay, what felt better? What felt better? Any other questions? Doctor, is there anything you can recommend to help women kind of risk in their receiving right era? I feel like we're so socialized and indoctrinated to believe that we got to hustle and grind and, care for everybody else and a lot to our own detriment. Is there any recommendations that you would have in terms of helping women to just kind of reverse that, right? Giving is a great thing, but learning how to receive. Like I run a digital advisory firm and we connect colleagues with funders. Some of our greatest assets go to Black women. Some of our best investments are with Black women, but they are the ones who ask for the least. Now I have a white boy come to the stage and he'll ask for $2 million. He ain't got a proof of concept, a business idea, nothing, and he won't blink an eye. Right? But then I have Black women who got proof of concept, running a great business. It's right, revenue generating. They're doing great business, and then they be like, oh, I just need 25,000, and I'm like, what do you want to do with that? Right? And so I'm trying to help them understand, like, it's okay to ask for what you need. And I always tell people, whatever it is you think you need, double it. Come on. So if you need $1 million, ask for 2. Right. So is there any recommendations that you have in terms of helping Black women to understand that it's okay to receive? I wouldn't say recommendations. What I just heard you say is, hey, sometimes we will battle with that imposter syndrome. And so sometimes just call it out. I had to call it out for myself. Girl, no, you belong here. This is who you are. Let me show up, okay? But I also heard a concept of really abundance versus scarcity mindset. And when you are in a position where you are able to ask, you can encourage that sister or encourage yourself and say, okay, let me just sit right here. How is my thinking? Am I thinking in a scarcity mindset or abundance mindset? And it's black women, but also I guess women in general. Sometimes we won't ask for more. And there, I don't know what particular study, but it was a book that Cheryl Sandberg, I think, she used to work for Facebook when it was there, and it was called Lean In, and she was talking about how we will show up and how we showed up and how men showed up, and we were going to ask for less, even though we were overqualified. And so when you are in those particular situations or have those opportunities, really just sit and say, okay, let me just practice stillness real quick. Okay, then also, where's my mindset? I always want to practice abundance. Okay, what are they gonna tell me? No? Okay, that's fine. But let me ask for double. Let me ask for more. Let me also walk into what I know that I am qualified for, and also put a little salt on it as well. Like because we have it. We have it. And so really in those moments, battle that imposter syndrome because she's gonna try to creep up, girl, go sit back down. And then also, hey, is this abundance mindset or I'm in scarcity?
Yes, I see a question in the back.
Hello, how you doing? So my question was dealing with so I'm like 35 now, and I noticed like in our community, over women do not teach us about hormone changes and how it affects the mental. So my question is like, do you have any suggestions or input about that? I think as a young black woman going into older ages and also for younger black women, they need to know that this is real and that it's not like something is wrong. Because that's why our first mindset goes to is something wrong with me. I need medicine. I'm depressed. I'm this, but in actuality, it's just hormones. So I think that's something that's really need to be talked about. That's not talked about. And it took me 9 years to figure it out, but I figured it out.
Yeah. So absolutely. So perimenopause is a thing. Okay. I'm like, what happened? What's going on? So we can experience whether it's that cognitive slowing or that brain fog. My thoughts not coming as fast as they used to. My sleep is all off. Girl, I'm sweating. What is going on? So yes, really having those conversations and talking about it. So I work with a lot of OBGYNs, and so they handle if desired, they handle that hormone replacement stuff. They handle that. And so they also refer them to me to say, hey, there is some decrease in those hormones, and so it's expected to have sometimes a low mood or anxiety. And I, as a psychiatrist, my job is to let you know your treatment options. And my job is also to tell you if we are at the point of medication, we don't gotta be on it for the rest of our life. So I am teaching or educating about, hey, these are the symptoms of perimenopause. These are the treatment options that you can from a mood and anxiety standpoint. And if you desire to go that way for medication, I let you know that I have other options in terms of that are non-pharmacological. So as you may be on the medication that I prescribe right now, I'm also referring to my good sis therapist over here. And so now while you're getting those coping strategies, well, now you may have to use a journal and have a planner now because sometimes it's not going as fast. And then also I'm journaling about my mood. I'm incorporating my mindfulness. I'm incorporating all these different skills. Now my medication dosage for you is going down, and now you off of it. And so just knowing, hey, I am going through a change. I may need some extra help and it may become in the form of medication, but now I have a care plan and I have not necessarily a timeline, but I have some particular goals and I'm in therapy that is, yes, working with these particular symptoms, but also it's helping my relationship, it's helping my parenting. And so all of it's connected. So, but just knowing that I have a care plan. So yes, have these conversations, talk about it because perimenopause is real. It's real hot too. Okay, so so just have those conversations. So I'm glad that you brought it up, but because that's my passion. So I have a lot of women. They're like, I don't know what's going on. All right, Mama, why didn't you tell me about this? Okay, I knew it was told in here, but you didn't tell me what you was going through. So yeah.
I think there's time for maybe one more question. Okay. Yes.
Anybody said, told you like Jill Scott? Jill from Philly.
Yeah. Oh my God, she does. What? Philly from Philly, are you here?
My name is Shawnee Nathan, and I am the founder of a Kingdom of Love. It's an educational system where I mentor and tutor children. And mine is just having those conversations with, I guess, not only the ladies as well as the men on, I guess, like the process of, let me see, how can I say this the right way? The process of their identity. Let's say that. Like, do you have any advice when it comes to like how I can be so much more of a light into my students' lives and stuff like that?
So if I heard you correctly, the question was, how can I, or what are some recommendations to really pour into these kids to really just show them who they really are? And I think just starting these particular programs that you have, and then also just affirming what you see, what you hear, because sometimes those kids don't even know how to articulate really what they are gifted to, what they have, they hold. So if you see something, hey, you're very creative. I see you also. You are able to engage. You're able to communicate. Really, just putting those words on it for those kids, so they can really start to really feel it, as well as, hey, I'm able to put a word on it, and I can also tell that to myself. So in the form of just affirming them, so they have that tool of being self-affirming for themselves.
I'm going to say, you know this, there's so many resources right here in this audience. We have so many resources in our community, and you know, we really need to be pouring that into support networks. I would say, peer-to-peer support as well. Sharing is caring. Would you like to share a little bit about that, Dr. Mimi, about how we can be more supportive in our community to help reduce the stigmas around mental health, to also help allow ourselves to be more vulnerable when we are met with some answers and met with some care? What kind of strategies could we be doing to build that into our communities more, those support networks, and, you know, to ensure that we're really resource sharing?
I think if we have a lot of resources here, so continue to have further these conversations. So continue to reach out, let people know what you're doing, what's your passion, what's your purpose, what's your vision, and just don't sit on silence. We have to battle that imposter syndrome, because I may need what you got, and really sitting down, having these conversations like this, and really stepping into your boldness. Like, if you got it, just say it. If this is my organization, then say it. Let me know, because you never know who you're going to bless. You never know, like, I've been blessed so many times when I tell people my particular story. Like, my story, I'm raising a kid with autism. And then when I put that in the atmosphere, okay, you have this particular resource? All right, so just practicing that vulnerability, but also still using wisdom and discernment, okay? But just stepping into what you know that you have, what you have been gifted to give to this particular kingdom, then just walk in it. Walk in it, like he told you.
I want to thank Dr. Mimi so much for using her platform in this way, letting us all this wisdom today. And where can people catch you?
Yes. So on social media, which I'm off right now, but it's still going. It's still going. I'm just not on it. It's drmimi.care, so drmimi.care. My husband and I, we own a mental health practice. and that is Inner, INNER, Community Health. And so you can do innercommunityhealth.com. That's our website. We're able to see clients in Georgia, Virginia, Maryland, Ohio, Alabama. However, we also have a nonprofit organization to do that particular preventative mental health resource. So drmimi.care and innercommunityhealth.com.
Thank you so much. You can catch this interview as well as other resources at For Your Health News at FYH.news, FYH.news, Your Health, Your News. Yeah, your power. Thank you so much. Have a great afternoon.
Hi everyone, I'm Ajwa Chimating from the National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And I'm sitting here with Polly Joseph. Could you introduce yourself?
Sure. I'm Polly Joseph. I am an investigator, and I am originally from Bethesda, Maryland.
Welcome, Polly. We're so pleased to have you as part of the 40 under 40 class of the National Minority Quality Forum's Minority Health Leaders. Congratulations for everything that you've achieved in your career. And, this is an interesting time for us. I think that generally folks are looking for leadership in a lot of ways, including in healthcare. And we're so excited because this class, we feel, have leaders from all sorts of disciplines. And so I would want to ask you, particularly during this time where there's a lot of either misinformation or folks are wondering about access to care, what would you say to others in your class or other health leaders about what they could be focusing on in their career and how they could be using their platform at this time?
That's such a wonderful question. One of the things that I would say to either the current class or previous classes like mine, I'm class of 2020, so I happen to be in the middle of the pandemic, is that, just to focus on your passion. and focus on building in the curiosity of what drives you. That will never change. No matter how the climate changes, what drives you never really change.
That's
because
true.
it's really within you. And that is what's going to help the community. That's what allows us to really do the day-to-day that we need to do. And then we can also provide the community with the right information that they need.
Right. What would you say has driven you to this moment? Could you share a little bit about your personal story, about why you chose your career and what, drives you on a daily basis?
So I am a trained nurse. I'm a family nurse practitioner, and I also did a PhD in genetics. So I run my own lab, doing a lot of work, primarily focusing on the chemical senses. So I've studied the senses of taste and smell. So it's really an area that most people don't study. But one of the things that really drove me to that area in particular was really working with patients. So working with patients, on the bedside, working at the nursing home, and seeing how patients will sometimes spit their medication, and often will say, oh, they're just not adhering to their medication. But often we really didn't think that the medication really tasted too bitter, right? So those changes are happening with age and how they influence nutrition, but as well as something that we do on a day-to-day basis clinically, like provide medications to other patients that we have. And that's one of the things that motivated me, but also one of the things that really motivates the work that I do as well is the fact that these particular senses are not measured clinically, especially in underrepresented minorities. There's really not a lot of tools out there. So one of my main goals is how can we embed this into primary care settings and have screening tools that can allow us to detect diseases earlier. For example, Alzheimer's, Parkinson's disease that is affecting our communities.
Wow. Okay, so much to delve into. Let's unpack that in 3 ways. One is I would love to learn a little bit more about the screening tools that you're talking about. I don't think a lot of people know what exactly you mean. Could you share exactly what that looks like in a primary care setting?
Yeah, no, that's a fantastic question. So our sense of smell tends to be affected at least 10 years earlier for individuals that have Parkinson's disease, for example. So if we can have screening tools that allows us to say, okay, this individual has a decreased sense of smell, we have to monitor them over time a little bit more. That can at least tells us a lot earlier that this person is a particular risk. However, right now, we really don't have anything embedded in clinical care.
Wow.
So if you get sick, you probably will be sent either to a neurologist, to an ENT, and it's very few individuals that actually do this test. Most of it relies into clinical research.
Alzheimer's is such a tough disease, particularly in communities of color where maybe we don't understand the signs. Could the screening tools that you're mentioning help with that process and be something that helps this community that often underdiagnoses and misdiagnoses this issue?
Absolutely. And sometimes it's things as simple as noticing how maybe your grandmother's cooking has changed, right? And often they're adding more salt or sugar to the food. And you're like, oh, it's salty.
Grandmother wouldn't get that wrong, right?
Right. They wouldn't get it wrong. So when you notice those subtle changes, it tells you that something might be wrong. And sometimes what's wrong is like their sense of smell, because the sense of smell and taste are very much linked.
It sounds so simple, but yet it's complex, isn't it?
Totally.
You mentioned lack of measures, in order that currently exist. What needs to happen to change that?
Policy. There needs to be a lot of policy change in, who reimburses for these tools that we are developing. We need things embedded, as I said, in primary care, but also neurologist offices. So sometimes we are asking for a little bit more to be done, but however, it's things that can help the community in general.
Right. Is this something that the average person can ask about or inquire about? What should the average person do if they're interested in this?
Yeah, one of the things is like if you notice that there's a change, there's advocacy groups that are primarily focused on this area, like the Smell and Taste Association of North America, for example, where you can learn more about what to do, where are the clinics where individuals can go. But if you notice a change, don't just attribute it to like, oh, like this is just extra salt in food, but just if you notice a pattern, to really start asking even the primary care doctor. Sometimes it's just asking that question that pushes an inch of curiosity.
This is so interesting, but I have one last question for you, and that is, you mentioned that not a lot of people know about this practice, in health, and of course, representation is so important to be able to determine things like taste, especially kind of our food, we have a different level of pepper, maybe a different level of seasoning. I'm just so curious about the importance of representation in this field. Is there a ton of representation of communities of color in this field?
Sadly, not. I think as you asked the question, you probably already knew part of the answer. And that's part of like the goal. It's like, how can we increase representation where we're not using only weird population, Western, European, or populations in studies, but we're also considering diverse communities. So one of the things that we were able to do during COVID is we created the Global Consortium for Chemosensory Research. So it's a consortium that includes individuals from 66 different countries. So we were able to do studies across all these countries. And that was a way to really increase representation from individuals in Asia, Middle East, as well as other underrepresented groups. So at least the needle is moving, but we do need more representation, not only in the population that we study, but also on the researchers that are doing the work and the clinicians.
Well, I want to just also say and commend you because you're class of 2020 and you're here today helping to welcome the class of 2025. How important is it for you to sort of continue to be a mentor, and what would you say to others in the future who will be the incoming classes of the 40 under 40?
Not to give
Everyone come to the exchange. We're gonna have a lovely conversation about how you can manage your health with the latest and the greatest tools. We're gonna talk tech. Any beatboxes? Oh, we got to check that.
Okay, go on. Okay, yeah. I'm gonna give out a signed book of the 3 that I have left. Yeah.
All right.
We got a free book and a T-shirt. I'm gonna throw a T-shirt.
Oh, a T-shirt and a free book. Okay, we're gonna be talking about what you need to know so that you're not in the emergency room. Okay. All right, and I'm just gonna get a cue from our live stream that we are on as well.
Hey, come on, brother, come on, man. Come on, come on, sit down. Hey, you, man, I see you. Come on and sit down. Let me rap to you. Come on, real quick. 15 minutes, 15 minutes. Come on.
Okay, so we're having a conversation, and then I will be chatting with Dr. Tomlinson, and then at some point I'm gonna ask you guys if you have any questions. Okay? So wrap your thoughts. Okay, Q, are we on? Good afternoon, everyone. Okay, if I say good afternoon, you say, yeah, I'm over in the south, right? Okay, I want to try that again. Good afternoon. That's right. Thank you. Thank you. All right. My name is Audra Chimating from the National Minority Quality Forum. This is For Your Health News at the Exchange live at Essence Festival. I want to say good afternoon to everyone here in the Park and Play at the Global Black Economic Forum, as well as hi to the 5,000 people online watching this live stream. We are here with Dr. Tomlinson of Vitality Health. Okay, Dr. Tomlinson, can you introduce yourself a little bit and explain what Vitality Health is?
Okay, so my name is Lou Tomlinson. The man who's my full name, but everybody calls me Lou. And I'm the CEO of Vitality Health. We're a healthcare company. We took care of about 12 million patients last year. And we take care of people in lots of different places, mostly in the hospital, unfortunately, but also in outpatient facilities. We also have Move Health, which is a functional medicine. So all of those cool and innovative new ways to be cared for. And then lastly, the president of Vitality Cares Foundation. We provide free healthcare for a lot of people. We have about 20 clinics across the country.
Wow.
And I'm also the author of Less Than 1%.
Oh my God.
A book I just,
do you sleep?
Sleep is well, not for your health. But I don't sleep. I don't like it.
No, okay. Wait a minute. So let's walk back a bit. New Health. New Health? Is that what you just said?
No.
Name all of your companies again.
Oh, so Vitality,
okay.
Vitality Cares. We also have an innovation hub, which is called Inflect.
Okay.
And then lastly, that functional medicine is called Move.
Move.
Yeah. Not Move. I'm Move.
I was wondering if you named it after yourself.
No, I didn't. A lot of people think
Move. M-O-O-V.
Yes.
Okay, Move. Okay. Okay, let's talk about what you said, 20 clinics, yes. Right? Where are those clinics located?
Okay, so Vitality Cares, we do 20 clinics around the country. That's the free healthcare. But Vitality itself, we're in 600 different communities.
Wow.
So we're all over the place, taking care of people, when they need it.
Right. And so explain what that looks like. Is that you walk into a facility and you get connected to a primary care, or is it really already when you're in an acute situation?
Yeah, most of the time, in most of our primary business is when people are having an event, heart attack, stroke, the worst day of their lives, they get to meet us. So that's, not the best, but we know how to bring them the best care, how to be compassionate. And then we have processes in place so that we can transition them back to the outpatient, back to their outpatient condition healthier. And so then we try to keep them in the system.
So explain about how you guys are transforming care delivery, because I think unfortunately a lot of folks in our community, Black and Brown communities, are used to just going to the hospital.
Yeah.
I have shortness of breath, or even I'm bleeding, or there is some sort of incident that occurred, and so you go to the hospital. Why should they be going go to your clinics?
So I don't know, all the Black males in the audience, there's one, I see one. Listen, I'm a doctor, and I hate going to the doctor. I'm just telling you, I know for Black people especially, it's very difficult and scary. As long as I can wake up and do some stuff, I don't need to go. That's my mindset. And that's an absolute wrong mindset. And so, I think the key is to make sure that we're creating awareness for healthcare that affects people in ways that they don't even know. And it's not when they just get sick that they're coming to sick.
I think there's been a lot of complaints about the health system. You know, the health system's really fragmented. It's difficult to navigate. You know, folks feel like they go and they're being told just to take a test or whatnot. How are you guys changing things in a real way?
Yeah, you gotta innovate. You gotta make the thing better for the people. You got, you know, if you look at the line, well, let's look at our booth. You know, we got we got like 4 people in our booth, and then you got 25 people lining up to listen to Beyonce. So we really need to understand that we need to make healthcare for the people.
Right.
You can't just create a system that works for hospitals or physicians. You have to get it to work for the people. Because if they don't want to, if they're not getting the care delivered the way they want it, they're not going to use it.
So we're in the age now of innovation, and there's all kinds of things that we can be using, all kinds of technology. What kind of technology are you guys integrating to advance and make healthcare faster and easier to access?
So we have 2 big major AI projects. We have an AI project that helps with documentation and also education for the patients. So when you come in, that AI will actually listen to the encounter and create a chart. So the physician now can just focus on you. You know, you don't have the physician typing while they're talking to you. So that's a really good tool. It's called Savant, SAYVANT. We have another AI tool that helps with transitions of care. So you talked about sick patients and how sick patients navigate their way through. So that product does that. That's called Rely, RELY. But I would just plug for any AI product, any healthcare AI product that y'all are out there thinking about using, use it, because it's a form of empowerment. Don't be scared by it. Don't avoid it, because if you're not part of the product or you're using it, you won't know how to critique it. So I think that would just encourage using that.
And you wouldn't be able to serve us, right?
Exactly right.
We have to feed AI in order for it to learn how to serve us how we want it to serve.
Exactly
right. Okay, so you know, let's talk about that trust factor with the health system right now. What would you say needs to occur? What strategies need to occur for us to break the levels of distrust that we're seeing?
So my first tenet in life is being disagreeable. So that, right? So the key, those who know me know that I'm disagreeable. And what that means is it's how you consume knowledge and information. It doesn't mean just going and tearing stuff up because you're angry. It just means, listen, if someone gives you some information, double check them. Ask them questions. So what the heck are you talking about? That's being disagreeable.
Double check your doctor?
Well, double check your doctor.
Really?
You better double check me.
Okay.
I'm saying, right?
Okay.
You gotta question everything. And I think what happens in healthcare, we expect that we should just accept. But other communities don't just accept. They're continually challenging and asking questions. Why am I taking that? Why are you putting me on that? Why do I need this surgery? What are the outcomes from that surgery? So that's the first step, is be disagreeable. But then you also have to be optimistic. You know that people are really trying to help you. So once you get your questions answered, you have to go through with what they offer to you. But don't be afraid. I think that's part of the problem. You know, we go in and say, "Oh, the doctor told me." No, so why? What is that? Is that right? Should I be doing that? And I think that's a patient empowerment that we need.
So I think right now there's a lot of anxiety. There's a lot of disorder. You know, particularly in the health system, we have, let me put it this way, policymakers who are introducing different ideas regarding healthcare right now. And so there's some confusion too around healthcare. You know, what would you say as far as how are you guys combating that? How are you using your data, especially because you all have invested in data? How are you using your data to help patients understand what is true or not, how to navigate this, you know, fragmented system, and understand, you know, what they need to do themselves in order to be healthy?
We always focus on the patient first. I think what happens in Washington is what happens in Washington. Sometimes it's something that you want, sometimes it's something that you don't want. It's the beauty of a democracy. But I will say that our responsibility is to make sure that anybody can impact and receive healthcare, no matter who they are, where they're from, what they look like, right? We know that some people have more barriers than others to that, and it's our responsibility to remove those barriers. And so, you know, that that mission doesn't change no matter what happens in Washington. And I think the same thing for us as patients. That what happens in Washington should never change the level of care that you expect, right? No matter who's in office. Now you might have to go through a little more, have to wriggle through the system a little bit differently. But I think the minute that you give up that power, saying, "Oh, look at what they did," or "Look at," then you've really given up the power. We're super powerful as a community, and if we're able to put that power in the right place, you know.
So how can we prioritize our healthcare? Because there are folks who are like, listen, I just need to be worried about my bread and butter issues. Of course, you're seeing people usually at the acute stage, but with the clinics that you have, when you mentioned free clinics, is that also for preventative care? Can you talk a little bit more about that?
Yeah, so we have lots of different, our free clinics that we do in those 20 cities I talked about, they're usually weekly or monthly. We try to screen people, blood pressure screen, blood sugar, BMI screening, and then plug them back into the community. So that's one aspect, but I think our goal is to be at every part of the healthcare process. I think in that way, because we're led by physicians and not by private equity and not by somebody who's making a lot of money, we feel like we can provide the best care for patients.
Can we talk a little bit about the importance of those screenings? How much that can change the course of a condition or a disease in the patient?
Yeah, again, guilty as charged. There's more screenings that I'm supposed to do that I don't want to do, and that's why me telling you this is much more important, because I'm not, I'm also talking to myself. The thing about it is, when you feel great, it's not the time. When you feel bad, it's not the time to go get checked. It's when you feel great. You know how to adjust things. You know how to change things. You know how not to eat and what to eat. And so I think that that's something that we don't always focus on, because sometimes we live in a hostile environment. Am I lying? We feel like we live in a hostile environment. It's hard to think of those things when you're just thinking about day-to-day struggle. And so it's really trying to move people back to say, Master P on stage said, doesn't matter how much money you have, if you're not healthy, it's irrelevant. So I think
He did say that.
He did.
Yes, health is wealth.
I was waiting for him to say the no. But he said some other amazing stuff.
Health is wealth. That's why NFUF, we're here partnering with the Global Black Economic Forum, because when we're talking about the future, you have to be alive for the future, right? Okay, clock it. So really, some of the things that you said is so important, and I think folks don't understand sometimes the importance of the right care at the right time, right? How is Vituity really advancing that part?
Yeah, I think it's we have something sort of a name that we came up with, which is called Health in Place, which means we want to get, to your point, empower the patients by getting the right care to the right time, to patients on their terms. On their terms is really a key word. It's not when we're open, it's not when we're available, but it's all the time, and it's the way patients want us to consume it. So that's really a focus. We're still getting better at it, but I think that ultimately is where healthcare is going to go. Healthcare is being consumerized right now, as you well know. So whoever does that better, forget money. Whoever does that better, that's going to be the standard. So we don't want someone else doing it the wrong way and being the standard.
And RFK Jr. has talked about the importance of wearables, for example, and can you talk a little bit about your perspective on those?
RFK ain't even a doctor. Do you guys listen to RFK? I'm not. I don't know. I don't care what RFK says, but I think that checking your blood pressure, checking your blood sugar, checking those things that are fairly easy are going to happen on your iPhone, right? They're going to happen on your iWatch. And so I think it's going to get easier and easier to do those things, and you won't need an entire lab to get that done. So, Dr. RFK.
That was a trigger. Well, you guys, I'm going to come to you in a second for questions. So think about your questions, but we're talking about the future of health here. I believe that's the name of this section, Future of Health. And so we have here right now an innovator. you know, that's looking like 10 years down the line, 20 years down the line of what healthcare is going to look like for our community. Would you like to share a little bit about your perspective on what is really the most important things that we need to know now about the future of health for our communities in particular?
Yeah, I think the number one thing that you want to realize about the future of healthcare is that it's all of you. We're moving away from these large, big white castles, big, edifices of care. Healthcare is gonna come to you as an individual. You drive it, and you're more important to the future of healthcare than I am. And you have to let people know that. You have to use your power. You have to empower yourself to make sure that you're driving the future of healthcare. I'll be honest with you, a lot of people don't know why we're here. Why Tuity? So when you go into Essence, why are you going to Essence? Are you just going to see, Master P? And I said, no, what we're doing is we're coming to the people that we're building the future for. And what better way to know what the future should be than talking to each of you and being intimately involved with each of you. That way you can actually direct that future. So to me, the future, especially with consumerism, the future is really yours. It's just now really getting us to stop being quiet, be a little disagreeable, right? Be optimistic, and then also be relentless, right? Never ever stop. Because if you drive it, if the people are driving the future of health, then they may get a benefit, but that next generation will get an absolute benefit, right? So it's a little selfless in a way, but if we can drive it, that next generation and generation after that won't have the problems that we're dealing with. So that's why they run, y'all run this. So it's up to you guys now to raise your voices, not just politically, I hear that all the time, but to raise your voices in your doctor's offices and with your physicians, with anybody you're talking about your health.
I love that. I love that. Okay. Are there any questions from the audience? Yes. Yes, we're waiting on the. Okay. All right. So yeah, my quick question is, so with Vitality, wanting to know what you guys are doing to engage the community, especially in this space where, health equity, DEI, things like that are like trigger words for some folks. So kind of just want to understand, what are you guys going into the community, and why should the community look to you as trusted partners?
Yeah, so the first thing I would say is that let's just talk briefly about DEI. Don't pull me off the stage. We probably didn't do the best job on talking about what DEI really is. It's been hijacked. And so I've been interviewed on TV several times. I don't use the words anymore because I believe that anybody should receive healthcare no matter where they are, where they're from. And we acknowledge that they have barriers and those barriers need to be solved. That's what DEI is to us. But people have replaced that with receiving things because of your race, which is not what we invented it to be. So the second part of that is what My Duty is doing specifically. I think about 5 years ago, I got frustrated with the bureaucracy of healthcare. That's when I started My Duty Cares Foundation. It was an opportunity to connect with people in their communities. So what we do is we do pop-up clinics in communities. We usually try to get a community partner because they know they won't trust us without that community partner. And we set up health fairs, we screen, we do blood pressure, we do BMI, we even have some places that do physicals and write prescriptions, but then we also feed them, we do haircuts, we have music. It's a big party, right? And so the idea is that it's a party where you might get checked. And so those are the kind of things we do. And I mentioned we have about 20 of those clinics that we do. We also provide scholarships for people aspiring to go into healthcare, because that's the key too, right? It's not just one thing to care for people. Now, can we increase the number of leaders that feel the way we do? And so we do scholarships, we do mentorships. We actually had our first graduate from one of our mentorship programs recently. So that's all we're doing. We still can do more. We're trying to scale up. We're trying to meet with other people, especially at this conference. But I think it's getting some momentum. Last year, we provided $8 million of free care. It's just pretty significant.
Wow, that's amazing. That's amazing. Not bad, guys. $8 million in free care. That's amazing. No pulling you off the stage. National Minority Quality Firm is with you on that. Okay. In fact, I have to say that tomorrow we'll be launching what we call the Physical Laws Framework, which is all about, having these conversations, making these healthcare decisions, having our healthcare system work for us, be more patient-centered, because it's rooted in biology and rooted in the science. The science says that African Americans need this, that regarding healthcare, right? The data says these things, that we need to have the right care at the right time to live longer and actually to live, period, right? So this is not something that needs to be bogged down by the politics as you have this chagrin of, yeah, the politics. It's really the data and the science that is governed by nature that states these things. So I really appreciate your commentary on that.
Oh, thank you. Thank you.
Yes. Yes. Okay, any other questions on the audience? Yes.
Yeah, I wanted to know what are your thoughts? Because nowadays people are taking a more holistic approach to their health as opposed to what the doctor prescribes to them. What are your thoughts on the importance? Is it important, more important, in taking a holistic approach to the health?
No, it's an amazing question. I'm still trying to move our company as a whole, but about 2 years ago, we stopped being a healthcare company and moving to a health company. This is what you're talking about. There's a big difference between healthcare, meaning come to me when you're sick, and health, which means come to me anytime you want to talk about your health. And so, our launch into Move, you can see those people in the compression booths. Our launch to that company was really about how can we create people more functional. And it's really not just health insofar as what medications I'm on, what diseases I have, but how far can I run? When I'm 65, right? Does my back hurt? All of these things that make us older than stated age, that if we worked on early in life and if we paid attention to, we'd be a lot healthier. Diabetes and hypertension, all these things would take longer to affect us if we affect all those things in my health. So I think that as far as holistic health, I'm down for that. Now, if somebody says, here's a magic ointment that'll cure your diabetes, I'm not going to subscribe to that. Like, come see me first. Take a couple drops of it, and then we'll see if the sugar goes down. So I think some people are trying to capitalize on that without data, without evidence. But absolutely, for those things that work, there's a lot of holistic remedies that work. And I think if they're proven, we should absolutely use them.
Let's build on that, because I think sometimes we can build our own care teams, right? So that we can have multiple touch points of, who we're talking to to make healthcare decisions. That should involve your doctor, should involve your primary doctor. Your primary doctor should know what else you're doing. What if you're taking supplements or if you're doing other things. Okay, I'm walking more. Okay, I'm eating this differently, because I think now we're looking at healthcare holistically in the sense of, it's multiple things that are happening to somebody, that may be resulting in certain outcomes. What would you like to add in regards to that, Dr. Thompson? I mean, what should a care team look like, for an individual, particularly for our community?
Well, I think your care team, obviously with your primary care doctor, you want to communicate all the things you're doing, all the things you're taking. I do think, though, that what you all have seen happen, it's harder and harder to get a primary care physician, right? And then also sometimes you're not really vibing with that person. That's somebody that just is on your panel. And you might end up with me and you're like, yo, I don't know if I like that guy. So there's going to be a lot of tools, I think, in the future that empower you. So I think part of your team is going to be you. You want whatever tech you have or whatever notes you want to keep, you want to document all your medications. And when you go to the doctor and they miss out on the medication, I'll say, hey, listen, I'm taking this, and you didn't say anything about it. I think you should also have a family member, however they're related to you, that understands not just the particulars of your care, but also what you want as far as your life goes, right? There's my mom, who, what is she, 80, 81? She wants everything done. If she goes to the hospital, she wants a robot. She wants to come out with one eye, with her own eye, and everything else is a robot. That's what she wants. That's how much she wants. My dad doesn't want anything. He wants to go, and if it's bad enough, he just wants to go away. And so I need to be responsible enough to communicate that so that he doesn't end up getting a robot and my mom doesn't end up just withering away, right? So it's just really getting people close to you that you trust, that if for some unfortunate reason you can't communicate with them, that they can communicate on your behalf.
Any other questions? Yeah.
I'm sorry, I came in kind of late on the whole speech, but what I did hear you say when I came in, some thought that's been going through my head very much recently is about taking control of our own healthcare and realizing it. I've been a nurse for 30 years. And it's just coming to me now that how much lack of knowledge there is amongst people in their own healthcare. So I've been thinking in terms of like creating some kind of wellness program where people start to the whole thing said holistically and to take control of their own healthcare, to know about how to create the healthcare that they want to have a good lifestyle. And I'm just not clear. The thoughts have been in my head. I'm not clear how I would go about it. I didn't know if you could give me some insight into that.
I think well, I have lots of thoughts about that. I think you're right. Trying to get that information. I mean, with ChatGPT and other things, information is not doctors only. It's not healthcare only. Anybody can get that information. It's all out there. I honestly think the best way to do that is through communities, and through, right now social media communities are the leading way. But if you can connect with people, either through social media or even in person.
Health fairs?
Yeah, health fairs. I mean, if you can connect with those people, you can create a body of people who can, do the same thing, work around the data, work around the information. But I think the isolation is the problem. When we're doing it in isolation, you don't have the opportunity to share.
I think that we would just add that, Madam Kuwait, that that information transfer is so important because otherwise we expend so much energy on things that doesn't actually lead us to the right decisions, to the right care at the right time, right? We spend so much energy trying to navigate a system that's very complex and honestly is stacked against our communities. And so when we don't have that information transfer, we make decisions that might not be actually right for us. Or we let someone else make the decisions for us that are not actually right for us. So it is so critical now because it's interesting. The more information that's out there, and often the less information we're actually getting because we are having a harder time discerning misinformation from facts, right? And it could be very confusing. So this is where, like Dr. Thomason is saying, how are we dealing with trusted voices? How are we working with trusted voices? How are we becoming trusted voices with our own community? There are more and more funding now, resources now for community navigators, patient navigators, people in our communities that can help with that. So I would say, hey, figure out where Vituity is going to be next and see maybe perhaps how you might become a patient navigator or a community navigator to tell people about the resources at Vituity. So yes, I think right now it's really tough with information, and it seems like it's getting a bit harder, but there are resources and tools out there that we could be utilizing for sure. Any other questions for Dr. Thomason? Dr. Thomason, how would you like to leave with us with a note, about sort of what you want people to really take away, especially as they come to your booth today? What do you really want people to take away from?
I would just say, back to what we talked about before, empower each other, empower yourselves. Again, come and talk to us. We're talking about AI in healthcare. We're also talking about functional healthcare. We'll tell you more about what we're doing in communities. And so I would say empower. Empowerment is the quote of the day, the word of the day.
Thank you so much for having us. I think we're ending at the right point.
It's party about to start.
It's about a party about to start. But we'll certainly have Tamar Braxton over here talking about HIV and AIDS. Okay. So please come back for our next conversation. Thank you guys so much.
Thank you.
Welcome. My name is Ajwa Chimerting from the National Minority Quality Forum, and welcome to For Your Health News. Your health, your news, your power. And I'm here with Dr. John. Introduce yourself.
Sure. Hi, everyone. My name is Dr. Donnie John. I'm the Executive Director of NovaScript Central, a nonprofit pharmacy based in Falls Church, Virginia, and I'm from Northern Virginia.
And we're so glad to have you here because you are just a long-standing, professional when it comes to the health equity space. You long in the tooth in that regard, as far as being a pharmacist, but also being a health equity advocate. Can you share a little bit about your journey as to how you decided to sort of go beyond your quote unquote 9 to 5 to get more involved in health equity issues?
Sure. I think it's growing up as an immigrant in this country, understanding the struggles that not only my family, but my community. I grew up in New York in a very diverse background with a lot of people from different ethnic groups really trying to figure out how to access healthcare, just services in general. So I think growing up, seeing my parents navigating the system, their challenges, it's really inspired me to figure out how do I fix these issues so that other families don't have to go through the same learning experiences, good and bad, that I've had to incur.
And so in your profession, what was the first thing you wanted to fix?
Health literacy. A lot of times we talk about health, but we don't talk about it in the terms of making people understand. Mm-hmm. And also the cultural competency perspective of not everybody speaks English and not everybody has information in their native language. So for me, my passion over my 20 plus years has been health literacy and cultural competency, is how do we empower communities from all backgrounds to really understand health information so that they can be empowered to make a choice.
And have you seen progress at all? I mean, we've been fighting for health equity at NMQF over 2 decades. And a lot of people say we're just not really seeing any progress. But have you seen progress in health literacy at least?
Yeah, I think we have made a lot of progress, especially being more inclusive in terms of people with disabilities and having more information that's translatable. There are a lot of great organizations. NMQF has definitely taken the lead in bringing people together for stakeholder conversations around cancer and other really big health topics, and really lending a voice to all communities, regardless of race, gender, or background. NMQF has done a really good job of bringing us together to have a unified message.
So let's talk about hot topics. In your view, in your perspective, what are the hottest topics in health equity today?
I still think health literacy is a big issue where we're not breaking down information simple enough to connect people. We have built a lot of great resources, but the messaging is not clear enough where communities feel comfortable, because most people are not going to read scientific journals. They're not going to go to their doctor's office believing what they're hearing. They're really looking at their friend. So we really do need to work on building trust and making sure that communities are getting information the way that they want to hear it, whether it's through social media, whether it's through word of mouth in their community, whether it's through their church, their synagogue. We have to be where people are and really communicate on a personal level. And empathy is the best way to really help us create a strategy around that.
So you kind of jumped to it. You talked about social media, you talked about through church and through our social spaces, but a lot of times folks don't have the information. So how do we close that gap? How do we equip people with the information who are already the trusted voices in order to reach folks?
So I think first we have to build with them. A lot of times we build in a vacuum instead of building with the people that community members are trusting in the room. So finding the trusted messages is not challenging if we look at the right places. A lot of times people use that as a cop-out, as an excuse not to do the work, where English is the primary language. We'll put that on our product roadmap, or we'll figure out how to translate materials later on, instead of designing it from the beginning, where there's lack of resources and a lack of funding. So we have to look at how do we judiciously spend the money to make sure resources are being scalable and actually used by the community that we're trying to target.
Okay, so you talked about resources and spending money. But as you know, federal funding is being cut for a lot of health promotion programs across the country. So where do we find the resources now? How do we fill in that gap?
So I think there's a lot of resources out in the public domain. It's just a matter of knowing how to elevate those resources, because everybody's creating things in different silos. And when we look at the United States, we're a cultural melting pot. It used to be that we would have big metropolitan areas where we'd see predominantly specific ethnic groups. But when we look at Minnesota, it is a very culturally diverse community with a lot of richness in terms of all demographics. And they have a lot of great health education in multiple languages available through their state. Same thing in California and Texas. So we need to look at how do we collate these resources, make it easier to find. And hopefully with AI, it allows us to figure out how do we make it an easy catalog of educational content. My organization, we develop a lot of educational content on our own, really reflecting the diversity of the community. Plus it helps to have a diverse workforce, a diverse staff that can create this content.
So, some people have complained or shown some concern about AI, that it might not account for or protect from racial bias, because AI is still built on human perspective, right? And we have not rid our society of bias. So what do you say to that about the usage of AI in, forming these materials and this messaging, and that concern about bias?
I think that's where the diversity of workforce plays a role. You need to have a diverse workforce that's helping to build these solutions. Because a lot of times, as we've seen in the last 20 years of health technology, people are building it without any of us in the room. So we have to be present and really provide that contribution where it's not that the idea of diversity or multilingual resources is not a product roadmap for 2 to 3 years.
Yeah.
The MVP, the minimal viable product that everybody talks about, should be something that's minimally viable for everybody, not just a luxury to have. But having a diverse workforce will really help solve the problem.
Okay, last question for you. NMQF is just inaugurating its 10th 40 under 40 class of minority health leaders in this country in a particularly tough time. What would you say for those in the newest class about how to either stay the course, use their platform, or, as you said, cultivate the messaging, to advance the messaging, to help people in these communities?
So I think the biggest thing is to still have hope. There's power in the work that we do. And it's just a matter of using this chaos to create opportunity. How do we bring people together? Working in the nonprofit space, we have to get creative with having very limited resources. So for me, it's not a new issue of dealing with very limited access to resources and having to serve the greater community. But I think this year's class of 40 under 40 leaders are truly amazing. They have a lot of experience and a lot of brilliant ideas. So I'm very hopeful in seeing how they can kind of push the needle forward, but just staying positive. I think staying positive and figuring out being a solution-oriented framework versus kind of just restating the problem is not enough.
Right.
We need to really work on how do we take what we're doing, scale it, and really think about unifying messages to bring everyone together.
Hi everyone, I'm Ajwa Chimerting from the National Minority Quality Forum, and this is For Your Health News. Your health, your news, your power. And I'm sitting here with Polly Joseph. Could you introduce yourself?
Sure. I'm Polly Joseph. I am an investigator, and I am originally from Bethesda, Maryland.
Welcome, Polly. We're so pleased to have you as part of the 40 under 40 class of the National Minority Quality Forum's Minority Health Leaders. Congratulations for everything that you've achieved in your career. And, this is an interesting time for us. I think that generally folks are looking for leadership in a lot of ways, including in healthcare. And we're so excited because this class, we feel, have leaders from all sorts of disciplines. And so I would want to ask you, particularly during this time where there's a lot of either misinformation or folks are wondering about access to care, what would you say to others in your class or other health leaders about what they could be focusing on in their career and how they could be using their platform at this time?
That's such a wonderful question. One of the things that I would say to either the current class or previous classes like mine, I'm class of 2020, so I happen to be in the middle of the pandemic, is that, just to focus on your passion, and focus on building in the curiosity of what drives you. that will never change. No matter how the climate changes, what drives you never really change.
That's
because
true.
it's really within you. And that is what's going to help the community. That's what allows us to really do the day-to-day that we need to do. And then we can also provide the community with the right information that they need.
Right. What would you say has driven you to this moment? Could you share a little bit about your personal story, about why you chose your career and what, drives you on a daily basis?
So I am a trained nurse. I'm a family nurse practitioner, and I also did a PhD in genetics. So I run my own lab, doing a lot of work, primarily focusing on the chemical senses. So I studied the senses of taste and smell. So it's really an area that most people don't study. But one of the things that really drove me to that area in particular was really working with patients. So working with patients, on the bedside, working at the nursing home, and seeing how patients will sometimes spit their medication. And often will say, oh, they're just not adhering to their medication. But often we really didn't think that the medication really tasted too bitter, right? So those changes are happening with age and how they influence nutrition, but as well as something that we do on a day-to-day basis clinically, like provide medications to other patients that we have. And that's one of the things that motivated me, but also one of the things that really motivates the work that I do as well is the fact that these particular senses are not measured clinically, especially in underrepresented minorities. There's really not a lot of tools out there. So one of my main goals is how can we embed this into primary care settings and have screening tools that can allow us to detect diseases earlier. For example, Alzheimer's, Parkinson's disease that is affecting our communities.
Wow. Okay, so much to delve into. Let's unpack that in 3 ways. One is I would love to learn a little bit more about the screening tools that you're talking about. I don't think a lot of people know what exactly you mean. Could you share exactly what that looks like in a primary care setting?
Yeah, no, that's a fantastic question. So our sense of smell tends to be affected at least 10 years earlier for individuals that have Parkinson's disease, for example. So if we can have screening tools that allows us to say, okay, this individual has a decreased sense of smell, we have to monitor them over time a little bit more. That can at least tells us a lot earlier that this person is a particular risk. However, right now, we really don't have anything embedded in clinical care.
Wow.
So if you get sick, you probably will be sent either to a neurologist, to an ENT, and it's very few individuals that actually do this test. Most of it relies into clinical research.
Alzheimer's is such a tough disease, particularly in communities of color where maybe we don't understand the signs. Could the screening tools that you're mentioning help with that process and be something that helps this community that often underdiagnoses and misdiagnoses this issue?
Absolutely. And sometimes it's things as simple as noticing how maybe your grandmother's cooking has changed, right? And often they're adding more salt or sugar to the food. And you're like, oh, it's salty.
Grandmother wouldn't get that wrong, right?
Right. They wouldn't get it wrong. So when you notice those subtle changes, it tells you that something might be wrong. And many times, sometimes what's wrong is like their sense of smell. Because the sense of smell and taste are very much linked.
It sounds so simple, but yet it's complex, isn't it?
Totally.
You mentioned lack of measures, in order that currently exist. What needs to happen to change that?
Policy. There needs to be a lot of policy change in, who reimburses for these tools that we are developing. We need things embedded, as I said, in primary care, but also in neurologist offices. So sometimes we're asking for a little bit more to be done, but however, it's things that can help the community in general.
Right. Is this something that an average person can ask about or inquire about? What should the average person do if they're interested in this?
Yeah, one of the things is like if you notice that there's a change, there's advocacy groups that are primarily focused on this area, like the Smell and Taste Association of North America, for example, where you can learn more about what to do, where are the clinics where individuals can go. But if you notice a change, don't just attribute it to like, oh, like this is just extra salt in food, but just if you notice a pattern, to really start asking, even the primary care doctor, sometimes it's just asking that question that pushes an inch of curiosity.
This is so interesting, but I have one last question for you, and that is, you mentioned that not a lot of people know about this practice, in health. And of course, representation is so important to be able to determine things like taste, especially kind of our food, we have a different level of pepper, maybe a different level of seasoning. I'm just so curious about the importance of representation in this field. Is there a ton of representation of communities of color in this field?
Sadly, not. I think as you asked the question, you probably already knew part of the answer. And that's part of like the goal. It's like, how can we increase representation where we're not using only weird population, Western, European, or populations in studies, but we're also considering diverse communities. So one of the things that we were able to do during COVID is we created the Global Consortium for Chemosensory Research. So it's a consortium that includes individuals from 66 different countries. So we were able to do studies across all these countries. And that was a way to really increase representation from individuals in Asia, Middle East, as well as other underrepresented groups. So at least the needle is moving, but we do need more representation, not only in the population that we study, but also on the researchers that are doing the work and the clinicians.
Well, I want to just also say and commend you, because you're class of 2020 and you're here today helping to welcome the class of 2025. How important is it for you to sort of continue to be a mentor, and what would you say to others in the future who will be the incoming classes of the 40 under 40?
Not to give up. Sometimes the world can look a little challenging, but just to keep focus, and as I said earlier, just to seek that inner curiosity that leads to questions, and not to give up on that neither. Because the day that we give up not only on ourselves, but we give up on our communities.
Wow. Thank you so much, Polly. It's nice to have you.
Thank you.
We'll see you again, right?
Absolutely.
Okay.
Did you know that in the United States, nearly 2 million people are diagnosed with cancer each year? Tragically, cancer deaths are disproportionately higher in underserved communities due to barriers in early detection and treatment. At the National Minority Quality Forum, our mission is simple but powerful. We believe every person deserves the chance to live a healthy life, no matter their race, ethnicity, income, or where they live. Since our founding, we've been dedicated to reducing health disparities in communities that have been overlooked for far too long. Low income, rural, Black, Hispanic, Asian, and Native American. We lead the Cancer Stage Shifting Initiative and the NMQF Community Health Biobank, advancing diverse patient data for critical research in 20 underserved, high-risk cancer communities. This initiative focuses on addressing health disparities in cancer care by creating a registry and biorepository to support earlier detection and equitable access to innovative treatments. By working with 100,000 participants, we're taking a big step toward addressing cancer disparities and creating tools that work for everyone. Together, we can shift the fight against cancer to earlier stages and give every community a fighting chance. The National Minority Quality Forum is committed to transforming the health of our nation. Learn more about the Cancer Stage Shifting Initiative and how you can support this life-changing work at shiftcancer.org.
Hello, welcome to another episode of For Your Health News podcast. We have Dr. Otis Brawley here. We are so excited to have you as part of this conversation. We would love to learn more about your organization. Why was it important for you to be represented in this conversation?
Well, thank you very much. I'm here representing the CEO Roundtable, and I'm also a professor at Johns Hopkins University. Much of what I've done throughout my career is define what the cancer problem is and define what the problems are in disparities. And the route to overcoming disparities involves a spectrum of prevention, appropriate screening, and appropriate diagnostics and appropriate treatment. And the way you actually start the prevention part of it is through lifestyle change. And we need to work such that people are living a healthy life and doing healthy things at home, at play, and at work. So the CEO Roundtable controls a great deal of the at work part. There's also a part of the CEO Roundtable that's now getting involved with universities, especially with historically Black universities. Awesome. And so we want to try to encourage people to teach how to stay healthy and practice how to stay healthy, both at home, at work, and at play.
And tell us how that looks like on the ground, and can you highlight some of the work you're doing with HBCUs?
With HBCUs, there's a lot of education. We're meeting with leadership of the historically Black colleges. We're talking about things like, what are you serving in your dormitories? Is it lots of high carbohydrate, calorie-dense foods? Are we encouraging students to get exercise? And trying to get students to take those messages on to their families. So these are some of the things that we're doing.
And what's the most exciting part about this work right now for you?
The optimism, the interest that people actually have in health. One of the things we have to do sometimes is try to make sure that they do things that are very science-based and very efficient. Because, for example, in the realm of cancer, everybody talks about screen, and doesn't understand there are appropriate screening tests that we really need to do, and there's screening tests that just don't work. And if we spend a lot of time doing things that don't work, we take away from the things that actually do work, and we consume resources that could be put into doing things that would be much more valuable to the population. So the most exciting thing is the optimism, but that leads us with this challenge that we have to continue the work to educate about doing efficient science-based screening, efficient science-based prevention.
Is there an HBCU that you want to highlight that you're like, they're leading this effort? We can choose favorites here on this podcast.
Oh, no. You're not going to get me to go there. I've a family tradition at Morehouse College, but
course.
I'm not going to single out any particular institution.
Okay, we'll take that. Well, since right before you got on here, we talked a lot about your work at Johns Hopkins and also you living in Baltimore. And so what are you seeing the city of Baltimore doing in supporting healthy outcomes for people who live there?
You know, we have a very dynamic young mayor who's very interested in food deserts and food swamps. One of the things that we could do that would help the population as a whole in the United States and especially in Baltimore, if we could get everybody eating 5 to 9 servings of fruits and vegetables per day, if we could get everybody walking for just 20 to 30 minutes per day for exercise, and he's trying to promote health. He's got a very exciting DC Cancer Coalition that's talking about smoking. And they even have, they send underage people into various stores to make sure that those underage people cannot buy tobacco products. Tobacco being the leading cause of cancer in the United States. And of course, almost every smoker will tell you that they started smoking at the age of 14 or 15. So keeping tobacco out of the hands of 14, 15, 16-year-olds is preventing people from becoming smokers, and that's going to prevent a lot of death. Remember, smoking is linked to 18 different kinds of cancer.
Wow. I am walking away with that new information today. That might come up in trivia later on. So I'm definitely keeping that in mind. And thank you so much. I think it's important to highlight the public and private partnerships we're seeing here. You highlighting some of the mayor's work and of course the CEO's roundtable on this. So thank you so much for being part of this. And thank you for shouting out Baltimore. It holds a special place in my heart. And I love seeing the great work that's happening there. Thank you for making the time.
You take care.
You take care.
Privileged to be with you.
Thank you. For Your Health News is here with Jocelyn Ulrich, representing Pharma. Spotlight is on you to talk about Pharma and some of the grants and how this work is helping communities move forward.
Yeah, thanks. And thanks for having me.
Of course.
I'm thrilled to be here. So, we were talking earlier today on the panel, and I can highlight some of the things Pharma has been doing. We know that social factors have a lot to do with how patient outcomes, end up happening for patients. So where you work and live has a lot to do with how you experience healthcare. Are doctors available? Is it a pharmacy desert? What is your access to healthy food and water like? And so Pharma created a CARES grant program. To date, we have given out over $500,000 in grants to improve health equity and equitable access to medicines. So it's been a very successful program. We also gave out a much larger grant. That's about $20 million to several academic medical centers, Vanderbilt, Morehouse, and the Yale School of Medicine. And the goal of that partnership was to build clinical trial sites in local communities. So to make sure that we were providing the ability to participate in a clinical trial where patients work and live. And that is going to help ensure that there is some long-term infrastructure at the community level. And we have a lot of learnings from that. We're in our learning phase now, so we're hoping to understand what's really going to move the needle on diversity in clinical research.
No, that's awesome. And clinical research is something that a lot of communities just are not aware of. They are not sure if it's for them. And we've talked a lot about clinical trials and how we need to have more diverse voices and diverse people in clinical trials. Is pharma doing any work in that and making sure that more people feel comfortable coming and working within this research?
Absolutely. So beyond just the grant to create the infrastructure, our member companies are also deeply committed to making a difference here. I think over time, we've learned a lot about what really matters to make sure that, again, we have research sites that are in communities. We've been using different tools like digital health, decentralized clinical trials. With the COVID pandemic, we learned a lot about how to bring research to patients in their homes. That's made a big difference so that patients don't have to travel so far to a site. I think we've become much more attuned to how we explain the clinical trial process to patients and made sure that there are people in the community who are well-versed in explaining the benefits of volunteering for clinical trials so that we can build trust in the community and that they're learning about the opportunity, say from their local church or from their community groups or their local healthcare center so that they feel more comfortable. And so over time, I think we're learning a lot about what it means to meet people where they are and to reestablish the trust. So our companies are working very hard to do that. It has really been a priority over the last decade at least, and we're hoping that we'll continue to see improved rates of participation across many disease states.
And as working at pharma, are there any things that are particularly surprising for you being on the inside once you're engaging with this community? Are there questions that you're seeing that you're like, oh, I didn't think about this before, but working within these communities, I've learned so much more about what they need?
I think, we've really learned to listen to the community and, things that happened in the past, Tuskegee, other things that really were important, really matter. And so we have to acknowledge that and address that and rebuild the trust. Beyond our member companies, pharma also has clinical trials principles, and so we have committed to addressing diversity and improving health equity in those efforts. So again, it's about really listening well and understanding and meeting people where they are.
No, that's important. And historically, people, when they think about the pharmaceutical industry, they're not saying, oh, maybe it's a place that wants to hear my voice. But what I'm hearing from you is that we actually want to hear your voice.
Yeah.
This is not something that's an isolated process. You providing us information helps us to be able to provide better, solutions for the health issues you might be facing. Is that the case? I don't want to put words in your mouth.
Yeah.
Okay,
yeah.
Great. Is there anything that's particularly, like, let's say next year, you're like, watch out for that. This might be coming down the pipeline that you want to preview for us?
We do have a new report that's going to be coming out sometime this year, pretty soon, talking about just the industry's diversity, equity, and inclusion efforts. So not just about clinical research, but what are companies in the biopharmaceutical sector doing to improve workforce development, to create resources like employee resource groups, create a STEM pipeline. So we're doing a lot of work in communities to bring more diverse people into the industry itself. So you'll see that report coming out sometime soon as well from pharma.
Yeah, and I like that pipeline. So many people are just, how do I get there? What does a job look like in there? And so I'm glad that pharma is working on that. Thank you so much for being part of this podcast and being part of this conversation.
Thanks for having me.
Of course.